Ovarian Shine Conference. We are so thrilled to be able to host these for you, a couple times a year, because we know that it's special that we have something that the information is, very relevant to you. So thank you for signing up. Thank you for being here with us today. My name is Melissa Christie. If you don't know, I know that you've all seen emails from me, and we communicate very well together. And I am your senior wellness program manager here at Unite for Her. So again, thank you for being here. We have a great lineup today. And as Sue was talking, I know you guys are all very familiar with Sue, but we are just going to let her say a few more words before we get started, just to welcome you all here today. So sit back and relax and enjoy the show. And again, if you have any questions or comments that you want to put in the chat, you are more than welcome to. So again, welcome. And I hope you enjoy our programming today. And Sue, there you go. Thank you.
Yeah, thank you, Melissa. So yeah, a little bit about Unite for Her, and all of you are so familiar with us by now, of course, and in our program, and a little bit about how we've grown over the years, because we really have gone from serving in a 3-state area to now serving every state across the nation. And our Ovarian community is so close to our hearts, and we want to grow this community that we really want your feedback, and today is a day that you have given us topics that were front of mind. So that's why we're reporting on them. So we would love to hear more from you. Please use the chat. You're all familiar with, Zoom by now. Send an email to Melissa. We would love to understand what is front of mind. What are the topics that you are most interested in? What is it that we might not be doing that you would love to see us do more of? These are ways that we create that community that is very thoughtful and very meaningful, and allows you to get the answers that you're looking from our professional advisors and team. We have an extraordinary team of medical advisors, business advisors, providers of all different modalities, complementary care. Clearly, Unite for Her is so invested in complementary integrative care. It actually helps you in a way that emotionally and physically can give you that control that you lost, during this time. And all of you know my story by now. That is how I created Unite for Her, being a survivor now going on 19 years come next week. And it really was trying to dive in and learn ways that I could get that confidence back. I could get control back, because I was blindsided. I couldn't get over that they had me as a cancer patient. I swore they had the wrong girl, but they did. They had the right girl, right? And I had to meet that where it was and understand how I could go one step at a time to then grow past it, grow and learn, continue to learn, and understand what was going to make me whole, which is very different that might make your neighbor whole. Right? Like, we all have a different way that we go about wellness and healing. And I have to say, it is an active motion, right? Like, to be involved in a wellness plan or a wellness routine. You hear a lot about wellness. It's become a little bit of a fad, but it's not a fad. It is where you get to plan out what is going to keep you emotionally and physically balanced. And we're helping you along the way. And that's what today does. Today is a way to continue to educate you. So Unite for Her has done a lot to create a community around our ovarian community. Some ways that you can get involved. Please join our cooking webinars. I don't know if you realize that, but we do 48 of them live each and every year. And we have Michele DiCristofaro with us, going on 4 years at Unite for Her, coming up next week. And she is one of 4 of our registered dietitians that are on our team. One of our dietitians solely speaks Spanish. So we are really involving the community, the Spanish community, so that we can meet them where they are in their culture. Another way to get involved is jump on to our speaker series, our education series, our Ask the Experts, our virtual hangouts. They are valuable. This past week, if you are not getting our newsletter, sign up. You're going to end up seeing that in your email, and it will tell you the roundup or what's coming up. Or if you're following us on social media or on Facebook, you'll see the topics that are coming up for the month and the ones that actually we just did. So for example, in April, we just did demystifying medical marijuana, cannabis, tell us what it's all about. How can I use it to actually help my side effects and symptoms? Another one that we did was on genetics and genomics. What type of genetic testing should I be taking? Has it transformed and changed, over the years? That was an Ask the Experts with Dr. Renee Quarterman. She was amazing. And then at the end of the month, we actually have our advisor, Jolene Hart, coming in, and she's going to be talking about how to understand sunscreens. We're coming up, on the summer season. That there's a lot of toxins and chemicals in our bath and beauty products. Clean beauty is definitely out there and people are talking about it, but there's a reason people are talking about it. And it is because these chemicals do disrupt our estrogen levels. So what can we do? We learn, we know what to buy, we know how to cover up, we have tips and tricks to teach you that. And that's an Ask the Experts that's coming up in the end of April. So again, it just allows you to understand how you can be involved in the community, get your answers front of mind, really learn and dive into some of the topics that you may want to learn more about. We're always putting experts and advisors front and center. Know that we want to listen to you as well. So again, if there's a topic that we haven't talked about, even just while you're on this event today, put in the chat, let Melissa know, say, hey, here's a topic. I would love your team to just take a look at this and do a little investigating, and you'll be sure to see it. We really take our community's advice to heart, and we want to make sure that we're meeting you exactly where you are. Another thing that allows to build community, we keep talking about community, and we have a Bloom fashion show coming up. We actually have one of the models right here in the audience today, and that is our girlfriend there, Cynthia. And our Bloom fashion show is really a place where we just have joy. We all come together. It's a fabulous luncheon. It's next Sunday. If you want to join us, please do. We actually have someone who has an ovarian only table. So trying to build community, in this big breast cancer space of the ovarian community, we take that seriously. So if you wanted to come and join us for Bloom, tickets are on sale until Sunday, but let us know, put me in with those ovarian tables. I want to sit with that community, because we will do that for you for sure. Just another way to get involved. Walking and running, a 5K. We have a chef and wine tasting event. We have a gymnastics event down in Philadelphia, which is super fun, but usually a very niche topic, and you're a fan, of gymnastics that you want to come down to. But it is, good for you to be along in a community where you can just understand where you can get the answers that you need, and you can filter through all the noise. And that's what Unite for Her is here for, is to help you filter through the noise, get educated, get empowered, and gain control. Gain that control back one step at a time. So for us today, you have a wonderful agenda. I'm going to pass it on over to Michele DiCristofaro. She's one of our registered dietitians on our nutrition culinary team. You're going to see Michele cooking with you. And I talked about those 48 cooking demos. There you go, front and center, right in her kitchen, giving you all the best tips and tricks, and really how food is your medicine. We have a food for thought segment. And that food for thought segment, again, empowers you to make decisions on what goes in your body, on your body, and ways that we can keep you balanced emotionally and physically. So Michele, I'm going to let you take it from here. And thanks for joining our Shine Wellness Retreat.
Of course, happy to be here. And it's so nice to see so many familiar names. It's like visiting with an old friend, that's for sure. And later, as was mentioned, I'll pop down to the kitchen and do a quick cooking demo. But first, I'll do this really great presentation here. I'm going to share my screen here. There we go. Okay. All right. Excellent. Okay. So we will do some potty talk, which is a fun little word, but it's serious, obviously, but it's nice to bring some light to it, because we all go to the potty, right? we can all have issues sometimes. So this is an interesting topic that maybe we don't talk about so much. Usually the dietitians are all about food and cooking demos, but we also like to get into more serious topics such as this. So one of the most common questions that I get is, I have X going on. I'm not digesting well. I'm experiencing gas or upset, stomach upset. What should I eat or what should I not eat? And that's a very hard question because not everyone is the same. So we can give general advice, but it's going to be different for everyone. So one thing that we recommend is, so we'll give you that general advice. If you have constipation, we'll say high fiber diet, blah, blah, blah. Or if you're experiencing some IBS symptoms, we'll say maybe, stay away from this. However, the best thing to do would be to start a food diary. So start with your breakfast, write down how you feel an hour later, midday, end of the day, before you go to bed, the next morning. And then you'll have a little bit of a better idea of what could be affecting your GI tract. Okay. And it might not be one thing, it might be a few things. So that's probably the best way to do it. All right. So common culprits of some GI upset: stress and anxiety, IBS, food allergies, and maybe at that point you don't even realize you have a food allergy and something's going on. You're breaking out into a rash, your stomach is upset. So a good time to bring it up to your physician. So it might not just be the types of foods, it might be an allergy that's affecting you. Lactose intolerant, stomach virus, medication, any treatments that you're going through. And a good example of what I was just talking about, lactose intolerance, okay? It would be easy for us to say, well, don't eat dairy. However, someone who is lactose intolerant might not be able to digest milk or ice cream, but they might be able to digest yogurt or hard cheeses. Okay, so again, it would be playing with those foods a little bit to see what's working and what's not working for you. So we'll talk about two major GI symptoms, and one is constipation, and we'll talk about diarrhea in a few minutes. So constipation, the small, dry, hard, lumpy bowel movements. And even though you might have this 3 times a day, it doesn't mean, oh, good, I went to the bathroom 3 times a day. If they're small, hard, and lumpy 3 times a day, you are still constipated. So if this is going on for more than 3 days, or it's difficult to pass or have a bowel movement, or you feel like you're just not done, you're cramping, large amounts of gas, but nothing else is coming out, or your stomach is swollen, distended. Nausea and vomiting actually can be a symptom of constipation as well. So at some point, you might stop and think, all right, when do I need to go to the doctor? Because this isn't something that you should be dealing with for a few days. You want to make sure there's nothing else major going on, small bowel obstruction, anything like that. So any of these things that you're seeing here, maybe you've had that nausea and vomiting, now you have a fever on top of it. You're still experiencing all of those symptoms that we saw in the last slide. Blood in stool and weight loss. We should never, once you start experiencing some weight loss with any GI discomfort, then it's time to talk to your doctor about what's going on. So nutrition interventions. Generally speaking, without even talking about GI upset, women should be getting 25 grams of fiber per day, men 38 grams of fiber per day. We are only getting about 16 grams of fiber per day. So a lot of times that could be why you're constipated. You're just not getting that fiber in. So when we say eat fiber, there's actually 2 types of fiber. The first is soluble and the other is insoluble. So a soluble fiber acts like a gel. So think when you make oatmeal in the morning, you pour the water in and it absorbs and it turns into this gel, and it keeps you full long because it slows your digestion. We don't want that when you're constipated. We want things to start moving. So maybe move away from the soluble fiber and move more towards the insoluble fiber. So an example would be celery. we know once celery is in our digestive tract, it's not pulling in all this water and holding on to it. It is adding bulk to your stool, which promotes movement. So it's bulking up your stool, it's making it heavy, and hopefully gravity will start pulling that through, okay? We always say food first, but sometimes food is not going to do the job or complete the job. So thinking of an over-the-counter fiber supplement, so Metamucil, things like that. And these these fiber supplements might not be something that you need long-term, but just to get yourself back to where you should be. Mostly helpful when your constipation is not caused by pain medications, because we know with those hardcore pain medications that can constipate us. So a fiber supplement might not do the job for that. Hydration, a lot of water. That water is going to help push things through. Maybe warm water would be a little bit better than that ice cold water loaded with ice. Starting that in the morning. We've all heard about prune juice. If you're not a fan of prune juice, there's some other juices that you could try. Food-related probiotics, fermented foods. So I listed them here: sauerkraut, kefir, kombucha, kimchi. So probiotics are the live microorganisms that live in these foods, and they add the diversity to our gut microflora, okay? Now, you might be looking at this list and say, I don't want fermented milk, Michele, or I'm not a fan of yogurt. That's okay. Of course, we don't want you eating anything you don't like, but maybe just get more of that insoluble fiber into your diet. You know, and there's some other things too, you know, trying to keep a regular bowel regimen, you know, trying to go first thing in the morning, drinking your warm water, maybe rubbing your belly a little bit. Those are things that you can do outside of nutrition or any type of supplements to help move things along. Here are some other things: stool softeners, osmotic laxatives. What those do is they cause stool to retain water to help move it through. So again, there's your Miralax. Stimulant laxatives, which we know those things work pretty quickly. So there's different types of over-the-counter medications you can take. Check with the pharmacist, because it's not a one size fits all. If you have different things going on, you want to make sure you're taking the right thing. Herbals, whole other ball game. I would really check with your healthcare team before taking any type of herbal. All right, flip side, diarrhea. So this is an increase of 3+ bowel movements per day. Increase in liquidity. And as we know, that can cause dehydration. Our electrolytes get thrown off, and that can cause some nausea as well. Weight loss, fatigue, we're not absorbing all of those nutrients. In worst case scenarios, malnutrition, skin irritation. So it's not just, you know, I'm using the bathroom way more than I should, or I'm running to the bathroom. There's a lot of other things that can go on when this becomes chronic. So nutrition interventions, small frequent meals. As you're trying to get through this episode of diarrhea, instead of having 3 large meals per day, and you're probably not even feeling up to that, maybe you're doing smaller frequent meals throughout the day. You want to replenish, because you're losing a lot of those electrolytes and liquid through those bowel movements. So if you want to try an electrolyte containing food or a liquid, so think of a Pedialyte or Gatorade or vitamin water, there's these great little electrolyte packs that you can dump into your water. It's like a powder. Preferably would like you to do the no sugar added, especially if you're doing it for a few days. But honestly, if you just want that diarrhea to stop, you're going to try everything. But staying hydrated, because you don't want to get dehydrated. As far as fiber, you know, well, not as far as fiber, but trying to consume foods that are low fat and low lactose, so those dairy foods. Now we're going to increase those soluble foods instead of the insoluble. So think of things that are already broken down, easier to eat, like applesauce. That's been partly digested for you, right? It's very processed. So white breads, white pasta, rice, starchy foods like potatoes, those will work much better for your system. And then there's the psyllium. So again, over-the-counter products that you can try, talk with your pharmacist. At that time, limit gas-forming foods. So those cruciferous vegetables, broccoli, cauliflower, cabbage, Brussels sprouts, beans, avoiding straws and chewing gum. If you think about it, you're bringing air into your body, or if you're eating too quickly, you want to minimize how much air you're putting into your mouth and your esophagus, so it's not causing any additional gas. Reducing, eliminating caffeine, alcohol, spicy foods. Apologize for the misspelling there. I see that. Sorbitol or sugar alcohols, anything that ends in an OL. So erythritol, mannitol, those are sugar alcohols that you'll see in diet packaged foods. So those can cause upset stomach as well. Probiotics might be helpful. Again, those are those live bacteria that can add and replace some of that good bacteria that may have been lost as you're going to the restroom. Here are some prescriptions. So when diarrhea gets really, really severe, check with your doctor. Of course, you don't want this to go on for very long. There are some prescriptions out there, slows down an overactive bowel, soothes your cramps, bloating, gas, a bile acid sequestrant. So there's definitely some things outside of the over-the-counter regime or regimen that you can work with your doctor on. But of course, you see here the Pepto, the kaopectate, and the supplement L-glutamine. All right, so again, very important that you check with your doctor for constipation, diarrhea, if you find that this is really, you're going past that 2, heading into your 3-day mark. So moral of the story, what works for one person may not work for everyone. Listen to your body and check with your healthcare team. We good, Melissa? Oh, let me stop
I didn't know if you were going to stop sharing the screen.
No,
So
I was just going to stare at the. Like, what?
That was great information, Michele. And yes, someone just put in the chat that they didn't know that drinking from straws causes gas, and I didn't know that either. So that's a good part. And I do. Every day when I'm drinking my tea, I'm drinking through a little straw here. So, that may be something. So this is why. Excuse me?
I said, it's not always bad, just, with that GI upset.
Correct. This is why, we try to include this segment of Potty Talk here, because we want to be able to bring you these tips about that. And it's not always something that we want to talk about, but we find that it's certainly, helpful to talk about. So Michele, thank you for that. And before we move on, are there any quick questions for Michele about anything that was mentioned? And I'm just looking in the chat there. I don't see any questions, Michele.
Okay. And I'll be here all day. So if anyone wants to pop a question in, I'd be more than happy to answer it in the chat. Thank you.
Thank you so much. We'll see you a little bit later.
Yep.
Wonderful. Well, good. So we are going to bring on our next guest, and we have, Priscilla is all ready. Look at those funky glasses. So some of you may know Priscilla, some of you may not, but Priscilla is the founder of Stronger Through Cancer. And that is one of the fitness programs that we offer, through our passport usage. And Priscilla has a great story, a background of, what led her to Stronger Through Cancer. And I know many of our members who have used her services and continue to use it, the fitness, and they love it. They love it. And Priscilla is all about, showing how to build strength. And so that is what she's going to be doing with us today. And she is going to, just to give a little topic here, she's going to talk about effective ways to improve core strength. So Priscilla, thank you so very much for being with us
Thank
today.
you. Thank you. And hi, everybody. And thank you for commenting on my glasses because they're new.
They're cute.
I'm loving them, but you know, I'm progressive, so I have to get used to it. So yes, thank you, Melissa, for that nice introduction. And hi, everybody. I'm the founder of Stronger Through Cancer. I'm also a cancer survivor. So I feel really honored to be a part of this community and to be able to talk to you all today. So core strength, I'm going to preface a couple of things that I say with some just very honest truths, okay? When I'm talking about core strength, I'm not talking about like, you know, some photoshopped looking six-pack abs, because if that's your goal, I'm not the right person for that. You would want a personal trainer and you would want a nutritionist, because 80% of that look is the way you eat. I'm talking about deep core strength, the kind of strength that maybe you've felt being compromised from your surgeries or basically what's going on with your life. So let's start with the fact that there are 4 major muscle groups that make up the core, and they're big words. You know, rectus abdominis, transverse abdominis, external obliques, internal obliques. For the ease of remembering what I'm talking about, I will just talk about the front, the back, and the sides, right? And I liken this to thinking about wearing a corset, ladies, right? Like you've got a corset that runs like this. So you're talking about the front, you're talking about the back, and you're talking about the sides. Those are the muscles that make up the core that you need to be thinking about. Now, weakened core strength or diminished core strength can happen from a variety of reasons: surgeries, illness, injury, or just, you know, lack of activity. And you don't necessarily think about what the core does, but having a good solid core helps with a lot of things that we take for granted. So if you have a diminished core strength, you may feel like a compromised movement, difficulty with movement, getting up and down with ease, standing for long periods of time. It will affect your posture. The number one thing that it will cause you to kind of pay attention to is lower back pain. So I've been teaching yoga, for example, for over 15 years. Most people that come to me with low back pain, it's related to their core strength. So I'm going to teach you a few things today. A couple of them will be, let's say, easier than the others, and you can watch or you can do it with me. You know, I risk putting myself out there for you, so I would love somebody to do it with me, but you don't have to. I'm going to start with the easiest thing that I can teach, which is to imagine that you have a tight wire between your sternum and your belly button. And you want to keep that wire as tight and taut as possible. When there's slack, right? When they start to come together, that's when you're losing your core strength. And I'm going to show you from the side how that affects the posture, okay? So standing with my tight wire nicely activated, I have pretty good posture here. But if I let them go, if I loosen that line, my shoulders come forward, my back rounds. And if I were standing like that for any period of time, I would feel low back pain, okay? So we're gonna do that first and foremost, whether you're standing or sitting. I want you to identify those 2 areas, sternum and belly. And just imagine that that wire was getting tighter and tighter by you pulling them apart, okay? Now let them go as if you just clipped them, and then readjust and tighten them again. Beautiful. Let it go again, you clip them. And you're obviously exaggerating this, sure, but again, you've tightened them back up. So when you're walking, you can be very aware of that space. And I like that imagery, you guys, because when I was growing up, I had a little bit of a Buddha belly. So did my sister. I don't know what that was about, but we did. And my mother, love her dearly, but would say, watch your posture, put your chest out. And that is the absolute opposite of what we should do, because I'm going to show you with my slack line. If I were to put my chest out, see what happens to my lower back. You might not be able to see it, but I can feel it. There's a lot of compression in those lower lumbars. So I'm not trying to put my chest out. I'm trying to lift my chest and pull my belly away. So I've got a nice tight wire here. So that's the first thing you can practice. You can practice it sitting. You can practice it when you're walking. Just think tight wire, trying to keep those spaces apart from each other. All right, using that for the next exercise, I want you to do something called core bracing. So in your seat, you're going to tighten that wire, and then you're going to imagine that somebody's putting a corset on you. You can pull it apart or you can pull it together, and you're hugging the ribs into the body. And you're going to hold that for 5 breaths, because I don't want you to hold your breath when you do it. All right. So again, tight wire, hug the ribs in, and breathe. And then just relax, let it all go. I even let my belly kind of soften, okay? We'll do it again. And one way that you can practice this, again, sitting, lying in bed in the morning, right? Just brace your core, thinking about those 2 things, that tight wire and hugging it in as if you've got a corset on, but don't hold your breath, all right? We'll do it again. We'll do it for 5 breaths. Tight wire, hug the ribs in close like somebody's tightened that corset, and breathe. Beautiful, and relax. All right, one way we're going to add to that is what I love, belly breathing. But at the end of your exhale, I want you to pull your belly button towards your spine. So we're just going to breathe together, but I'm going to tell you at the bottom of each exhale to pull that belly back. All right, so sitting or standing or lying down, tight wire, core bracing. And here we go. Take an inhale with me. Exhale. At the bottom of the exhale, pull the belly back, all the way back. Relax as you inhale, let the belly kind of inflate all the way up into the chest. As you exhale, at the bottom of the exhale, pull the belly back. Again, this is number 3. Inhale, let the belly relax. Breath comes all the way up into the chest. And as you exhale, pull the belly back, all the way back. Good. 2 more, just like that. Inhale. Belly is relaxed. It might even inflate all the way up into the chest. As you exhale, pull the belly back. And final time. And pull the belly back. Good. Anybody feel any of that? I'm going to just pretend that you're holding up your hands, and I'm so happy. Okay. But seriously, if you felt it, that's because we use our diaphragm to breathe. There's 3 parts to our breath. There's the diaphragm, there's the ribs, and there's the lungs. We, as a culture, tend to be very shallow breathers. We also tend to be shallow breathers when we're in chronic stress or illness. So, you know, when you say, like, I feel like I haven't had a deep breath in a long time, or I feel like I'm constantly trying to get breath, your breath may be compromised. And chances are you're probably breathing mostly in your chest. The more you can breathe in your belly, you guys, and the more you can think about letting it inflate when you inhale and really pulling it back when you exhale, you'll be working your core muscles just by breathing, which is an autonomic thing that we do every day without thinking about. All right. So put a little thought into it, start to identify that feeling, that sensation, that muscle group, those muscle groups start to go, oh, you're doing something, you're paying attention. So that's the first couple of things that are pretty easy, generally attainable, hopefully. And now I'm going to show you a little bit more challenging posture. And for this, I'm going to get on the floor. You do not have to do it with me. Like I said, you can just watch, but if you wanted to, you could participate along with it. So I've got my yoga mat down here, and I've basically put my yoga mat against the wall, and I hope that you can see me. I think you can. All right. So what I'm going to do is I'm going to get down on my back, and I'm going to put my feet flat against the wall, and I'm going to practice that core bracing. But before I do that, I want to just say, I'm going to eventually change my position so that my hands are against the wall. So if you are thinking of participating and you don't want to move around too much, you could go right to that position where your hands are against the wall and you're on your back and your knees are bent. Okay, so first things first, I'm going to come down to the floor, and I'm going to try to come down to the floor without using my hands. That's another way of using our core strength, okay? So I'm coming all the way down, look at that. And then I'm going to get myself on my back and get my feet against the wall. And I want my knees above my hips, okay? This feels really nice in general because it's a way to ground into your lower back if you have lower back pain. So from here, I'm going to push against the wall with my feet, and I'll feel my legs engage. And I'm going to practice that core bracing. So I want space between my sternum and belly. I want to hug my ribs in, and I'm going to hold this position for about 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, if you're really pressing, you're going to feel that. Also, when you're pressing, you're in a slight pelvic tilt, you guys, so there's no space in your lower back area. You shouldn't feel like you've got an arch of any kind, okay? So that's one thing you can do. You can come a little further away from the floor, from the wall, and bring your knees back up, brace your core, and do heel taps. So I'm just bringing one heel down while my core is braced. And if it feels like, whoa, that's just too much, Priscilla, here's what you can do. Bring the opposite foot to the wall again. Heel to the floor, foot to the wall, heel to the floor, foot to the wall. Back and forth. See if you can do about 10 on each leg. So you would be doing 20, you'd count to 20, but it would come out to be 10 on each leg. All the while bracing your core, see how that feels, okay? All right, so remember I said I'm gonna flip over and put my arms against the wall. If you're wanting to participate, that's where I'm going. So once again, on my back, knees bent. My arms are just slightly bent. They're not straight, and my hands are flat against the wall. I want to brace my core. I want to push my hands into the wall, and I'm going to bring my knees up to 90 degrees. Hold and push against the wall. If I wanted to intensify it, you guessed it, I could bring my heels down to the floor. If that's too intense, I could have one foot to be on the floor, bring the opposite heel down, bring that leg up, and switch. So you're just keeping one up at a time. If you didn't want to be on the floor, you guys, you could do something like this standing. And let's say you're worried about your stability, you're worried about, falling or being off balance. Here's a way you could do this standing. You have a hand at the wall, or you back against the wall, or hold onto a chair, and you brace your core, tight wire, corset, and you bring one knee up, 90 degrees, and then the other, 90 degrees. Okay, so I could hold the wall while I do that, 90 degrees, 90 degrees. All right, okay, so the last and possibly the hardest one, and you don't have to do it, but I would love for you to at least see what would happen if I tried this. Sometimes when I say plank, people get nervous, so I understand. So I'm going to show you what is a forearm plank, so you're not on your hands, And you can have your knees down, okay? So let's look at this together. Sorry, I don't have the high-tech camera yet, so. All right, so forearm plank is very simple. I'm on my forearm, so I'm not putting too much weight on my entire hands and little skeletal muscle system, right? I come down to forearms, and I've got my knees on the ground. I'm gonna brace my core and see if I can lift one knee and then the other knee, all right? To be in the proper position for a plank, I want to make sure that my shoulders are just a tiny bit ahead of my elbows and my hips are not high and they're not hanging down. So I'm going to show you first. I want to make sure that you can see me. You don't want your hips way up here, but you also don't want them slacking down towards the floor like a hammock. You want really sturdy, steady body. Knees can stay down, core is braced. And you can just lift one knee and then the other knee. And at any point, if you wanted to see what it felt like, you could lift both, bring them down. Lift both, bring them down. You are using a tremendous amount of core strength to do that. It's attainable. Even with those modifications, you're working your core, all right? So there's a couple that are easy, there's a couple that are hard. And now I'm gonna show you probably what I would call the most attainable core exercise. Sitting in a chair. And yes, I have a couple cushions on my chair because my cat loves my chair. So I'm gonna just sit at the edge of my chair or way back in my chair, whatever is more comfortable. Hands cross my shoulders. I'm gonna brace my core as I come up and brace my core as I go down. And I'm gonna work up to about 10. Every time we get up and down without our hands, we're using our core. So you can, don't use a swivel chair, don't use a chair that has wheels. I'm doing the wrong thing here, but you could do this multiple times a day and you will be training your core. All right, anybody have any questions for me? I don't know if you can hear it, but I'm breathy just from doing that. That's how much work is involved in that. No
Yeah, I
question?
don't see any questions in the chat just yet, but that last exercise makes things, that's a great one because, you know, I think we are so conditioned to use our hands to pull ourselves up.
Oh yeah. Oh yeah. For sure. For sure. For sure. And I mean, if you don't have any issues with your balance, there's a lot of different ways you could sort of practice the up and down. You could do it on the floor, like getting up and down without the hands or with minimal hands. But I will also say that, like, if you're interested in improving your balance, you feel like you have really bad balance or you're worried about your balance, there's a direct link to your core strength. And I want to be really transparent with you guys. It's not like I have a six-pack. I like pie. I like my food, right? I do have a considerable amount of external skin, but I do have a very solid core in that I can support myself in a lot of positions and moves that I couldn't before. So don't think like, well, you know, I've got to excess this or I've got to excess this. I got to lose weight first. No. In order to build those muscles, you just have to train yourself to think about them when you're doing all those kinds of moves. And the first one is just standing, tight wire, corset.
Yeah.
I hope that helps you guys. I would love to work with any number of you. I have tons of women right now with ovarian cancer, so you're not alone if you join Stronger Through Cancer. And I hope you get a lot out of today. Thank you.
You're welcome. Priscilla, there are a few things in the chat. Are there any type of side exercises?
Side? You mean on your side?
Lying on your side, correct?
Oh gosh, yes. Yes, yes. But those are a lot more intense for sure. I don't want to lay down and do this, but if you were lying down, you could think about trying to get one hand towards the other knee, right? Like that. This is a great standing exercise, by the way. If you are working with weights, you could add a weight and do this. It's ineffective if you don't have the tight wire and the corset. If you're just going like this, you're going to feel it in your spine. You're not going to feel it anywhere else. But if this is all engaged and you move slowly, you're working the internal and external obliques, which are these things. Most of the time when you see people that look like they've had kind of photoshopped abs because they're just like six packs, that's the rectus abdominis. It's the easiest muscle to work because it's all this. Okay, you will never see me do a crunch. I don't do them. I had an umbilical hernia after my second baby was born. They're not good for you. They actually hurt your spine. So no. So to build the best muscles that you could attain to protect your internal organs and your sense of sort of space, right? You want to think about your internal and external obliques. That's the corset ones, the ones that you want to hug in close.
Okay. There is also a comment here from Sharon. It's saying that she wasn't exactly lined up with the incision from the sternum to the pubic bone.
Okay.
So ab work hurts.
Not pubic bone. Belly button and sternum. Is that what you were saying, Melissa?
Yes.
Okay. So your sternum is basically right there at your chest, right? Your belly button, I think you know where your belly button is. Not pubic bone. You want to think about having an imaginary wire connecting the two. And your duty to your core muscles is to keep that wire tight. If you're tightening something, you're pulling it apart, right? Like if I'm holding a belt in two hands, you guys, and I bring my hands closer together, what happens to the center of the belt? It sort of hangs, right? It's slack. Whereas if I move my hands apart, that belt tightens up. Same thing with your sternum and your navel. You want to imagine that you're trying to lift and press down so that that line is tight. You're going to feel that in your lower back at the same time as you work, because that's rectus abdominis and transverse abdominis, that lifting and pushing down. So I don't want you to think about lifting your chest, Sharon. I want you to think about imaginary line, trying not to let that line get slack, but to keep it tight.
Okay. And then she just clarified, and she's saying that her incision runs from top to bottom along the same line.
Okay, I got you. So you're worried about compromising your incision, or is it painful still, Sharon?
And Sharon, if you want to come off mute, that's perfect.
Yeah, for sure you can. Yes.
Yeah, she said it hurts.
Okay, so it hurts. Well, depending on how recent your surgery is or was, it will hurt. Okay, I had my stomach open, so I get it. Although my line went this way, it was horizontal. So you might need more time. But the other thing that you want to think about, Sharon, is the more you feel sort of protective of this, right? The more insular you are to kind of keep it slack, the more you're going to atrophy those muscles. Similar thing with our women who have breast cancer surgery. There's the posterior deviation where you feel like you're like, oh, I don't want to, where you actually do need to open it up. For you, same thing, hun, because this is going to eventually get to a point where it's going to affect your posture. It's going to affect your ability to move comfortably. It'll eventually affect your balance. You're not going to let it get there because you're going to slowly try to stretch that space. Try to stretch that space. And maybe the beginning for you would be lying down doing that. If you wanted to, you could take your arms overhead and think about, I just want to lengthen. I want to lift and lengthen this whole space. But it can take some time, but it's worth it. And as long as you're taking care of your scarring, you know, you've got some tactile movement there, you're doing some stuff with that, you'll be okay. You'll be able to do it.
Okay, great. Thank you. Thank you for that. And there's another question. Does core strength help hernias from getting bigger, or does it make it bigger?
No, it definitely helps. So listen, I've had 3 hernias. I've had an umbilical hernia and I've had 2 inguinal hernias, which are like basically where the men's, you know what's drop. Because I'm a dragon boater, so it's a lot of extension and a lot of core pushing. It is absolutely critical for you to have a strong core when you have hernias. Absolutely critical. The worst thing that we can do if we have hernias anywhere in the abdominal area is to get bigger. It is the worst thing you can do. The more belly fat you have when you have a hernia, the more taxing and pressure you're putting on that skin, those organs. And so it's the worst thing you can do. And I'm not saying lose weight. I'm saying you want to have core strength. What you want to do is avoid any kind of a crunch. That's the number one thing. If you've had any kind of abdominal hernias, no crunches. Because think about what a hernia is. It's an opening in the skin where things are trying to press through. So if you're doing this repeatedly, you're aggravating it, you're taxing it. You want to lengthen and strengthen. Think about long. Another thing that I didn't talk about was the bird dog, which is a really great exercise that lengthens your body. And if you were interested in that, you could shoot me an email and I would show you that too. But I've already taken a lot of time, so.
Perfect.
That helps.
No, those are great questions. And just one last question, like if it's a recent surgery, are there any exercises that you would recommend for, or is there a time frame before, a surgery that you should start to work on your core strength, or any exercises that you can recommend to do that? Or is everything appropriate what you said today, what you showed today?
I think everything is appropriate as long as it doesn't hurt. And I always preface that with, if you haven't exercised in a while, it's going to hurt. What I mean is like not muscle hurt, not like, ooh, wow, I feel something, but like pain. Pain should make you stop. Like, ooh, don't do that. But one of the best ways that you can sort of prep your body to start working towards that is breathing. Much more intentional breathing, thinking about the 3 parts of your breath, starting with the belly, letting it inflate like a balloon as the breath comes up into the lungs. And then when you exhale, remember, bottom of the exhale, pull that belly back. Think about a bellows, right? One of those things you use for the old-fashioned things that you use for fires. Mm-hmm. That's your breath. Opening it up, you're inhaling, exhale, close it. Same thing with the belly. Every time you do that, you're using your core. So as you're sort of recovering from a surgery, belly breathing, man, it's also going to help you with the potty stuff. Belly breathing, really important. Pull it back, let it expand on the inhale, pull it back on the exhale.
Great. That's wonderful. And I'm glad you said it's also going to help with the GI, because, and that's what we try to do. We're trying to bring this information all full circle so that we know how it works with one another. And that is absolutely so true. So thank you.
They're so integrated. Yep.
Absolutely. Absolutely. Thank you so much, Priscilla. Are there any last minute questions before Priscilla finishes up? That was great information.
Thank you all. Thank you all. Have a great day.
Wonderful. Thank you, Priscilla.
Thank you, Melissa. See ya.
Take care. Let me just remove that. Wonderful. So I think the takeaway there is, keeping everything tight and breathing. And, we may have heard this before, but we always need to bring it top of mind, because, it's so easy for us to fall back into the positions, the slugging. And even when she was saying it, I was trying to sit up a little bit more proper as well too, and breathe when we're doing that. So it's always good to bring that back to our memory. So that's wonderful. Well, thank you again, Priscilla. So I am going to search here, and I think everyone is here. I'm going to bring a few people to the screen now. I'm going to bring Rita on, and then Colleen, and then Melissa. Another Melissa. Perfect. There we go. Perfect. So these are our guests from NovaCare and Revital, and they are going to start with the next segment, but I want to take just a moment to read a little bit about their backgrounds too, so that you can identify. So let me get that propped up there, and I am going to start with Colleen. 1 second. I think I'm starting with Colleen. Oh, I am starting with Colleen, but it's in a different place. 1 second. Here we go. Oh, computers, right? Okay, here we go. I'm going to read Colleen's background. So this is Colleen Hickey. Colleen, if you want to just give a wave so we know who is who, perfect. And she is the National Director of Outpatient Pelvic Health Rehabilitation Programs. And she previously served as our Pelvic Health Program Director in the Mid-Atlantic region. Colleen has more than 30 years experience in the physical therapy industry, including 10 years in pelvic health therapy. And prior to this national role, Colleen developed and implemented a pelvic health program for the Select Medical UPMC joint venture in Central Pennsylvania. This program currently has 63 clinicians in 52 centers. And Colleen says the pelvic floor dysfunction negatively impacts the quality of life of millions of Americans, while conservative care has shown to be effective in treating this condition, and access to these services remain limited through therapy is underutilized. And she is very, very passionate about pelvic health and is honored to take on this leadership role to bring the highest level of pelvic floor therapy to those who need it. And then, thank you so much, Colleen, for being here with us today.
Thank you.
Next, I'm going to introduce Melissa DeStefano. And Melissa is an accomplished clinician who enjoys the challenge of treating a diverse patient population. And in addition to treating the general orthopedic conditions, Melissa excels at post-operative rehabilitation, vestibular and post-concussion rehabilitation, and lymphedema management. And Melissa is a Revital Cancer Rehabilitation Specialist and is certified in pelvic floor rehabilitation. And she's begun part of the NovaCare team since 2012 and is a graduate from Lebanon Valley College. And she enjoys spending time with her family and friends. Thank you so much, Melissa. And last, I am going to introduce Rita Padhiar. And Rita is the Revital Cancer Program Director in the Southeast Pennsylvania region, and she is a certified cancer specialist. The Revital Cancer Rehabilitation Program treats patients from diagnosis to survivorship and helps patients to navigate the side effects of treatments, improving their quality of life. Rita has been the center manager for Westchester Center for over the past 10 years, where she leads and mentors staff in clinical service and excellence. She is well-versed in manual therapy techniques, and she, in 2022, Rita became a certified lymphedema therapist, from the Norton School of Lymphatic Therapy. She primarily treats extremity breast cancer related to lymphedema and is an expert in prevention and treatment of stage 0 through 4 lymphedema. In addition, Rita has undergone advanced training as considered as concussion specialist. She is also skilled in the recovery and reconditioning program widely used to treat post-COVID patients. So we are very, very thrilled to have this panel with us today to talk to you today. So ladies, thank you so much for being here. And I'm going to let you to start this presentation. I don't know who's going to speak first, but I will let you do your thing. Thank you so much.
Thank you so much for that wonderful introduction. I'm going to just briefly start. Of course, after this wonderful introduction, I don't think I need to say more, but I am the Cancer Program Director for NovaCare, and I represent the whole of Southeastern PA market. We treat all the impairments due to cancer, and I think it was already said by Melissa. So today my role is basically going to be to support my two esteemed colleagues who are going to do the full presentation. I'm here to handle all of your questions and kind of navigate any other questions you might have about location and how these services are provided, insurance, and so on and so forth. The rest of the presentation is going to be led by Colleen and Melissa, and I think Melissa is going to lead it first.
Thank you, Rita, and thank you all for having us. I know I can speak for all of us. We're super excited to be a part of this and to just share with you some of the information and what's available to you versus needing to necessarily live with some of maybe the restrictions or impairments or difficulties that you may be facing now. So we do have a PowerPoint presentation. I'm going to share on the screen if that's okay. Give me 1 second here. And we can always send this to Melissa to then disperse to all of you if it's something you would all be interested in having. All right, so let me just. All right, so we are going to focus specifically on cancer rehabilitation for those patients, specifically you all who have either recently been diagnosed or have undergone treatment for ovarian cancer. I'm going to highlight really what cancer rehab is, what some of the major impairments or side effects we may see related to your treatments. And then Colleen is going to really take a focus more from the pelvic floor PT and what we can do as therapists to really help you for those more specific impairments. So cancer rehab in and of itself is a process that helps the cancer survivor obtain and maintain the maximal possible physical, social, psychological, and vocational functioning. The layman's version of that is our goal is to keep you as active and functional as you want to be, doing the things that you love, getting back to the things that you love, whether that's in your home, at work, with your family. Our goal is whatever your goals are. Why do we need it? Well, because of the current treatments and what's available to our patients and our cancer survivors, we have more of them, which is amazing. There are a greater number of years for survivorship after treatments, and evidence of long-term impairments that can be related to some of the treatments that you've undergone. So just some facts if you guys like it. There were 1,325 survivors with 10 of the most prevalent cancers, and it was found that at least 63% of those survivors had at least one impairment following their treatment and their care, requiring whether it's physical therapy, occupational therapy, some speech therapy as well. These are all services that many of you could benefit from or maybe already have benefited from through your cancer journey. Melissa pointed out that many of you are from across the country, which I think is amazing and wonderful. This map is just to kind of point out where and the numbers of survivors that we do have in different parts of our country. So all of you fall into that category, which is amazing. But just so you can see where some of those services may be most needed. Who really delivers the care for cancer rehabilitation? As I mentioned, we have physical therapists. As Rita pointed out, myself and her, we are Revital certified cancer specialists, which requires additional education and training to learn exactly what those treatments that you guys have gone through, from chemotherapy medications and what long-term side effects are to the surgeries that you've had, to help you anticipate some different functional changes, whether it's strength, range of motion, balance, and then again, specifically for this, the purpose of this talk, pelvic floor, incontinence, constipation, pelvic pain. So from a PT standpoint, some of those are the main things that we look at, but we do have colleagues as well within NovaCare, Revital, and then other practices, occupational therapists that tend to look more at your bathing, your dressing, your feeding, and how you do that. They can also look at some of that chemo brain and your ability to focus and remember, and have learned different techniques and skills to help you overcome some of those challenges with memory and cognition. And then our speech language pathologists, not so much specific with ovarian cancer, but those that have had head or neck cancer can help with speech and swallowing. And again, just some of that forgetfulness and word finding difficulties that can be associated with your chemotherapy treatments. Cancer rehab and our rehab clinicians are just a part of your whole cancer care team, from your doctors, your nurses, your physicians. ultimately with you being the main participant in the middle. So our ultimate goal is to support you, your needs, and what you really want to accomplish and get back to doing and living life the way that you want to after cancer. So ovarian cancer in and of itself, to speak of, group of diseases that originates in the ovaries or in the related areas of the fallopian tubes and peritoneum. Being that all of you are at different stages through the process of from diagnosis through finishing treatment to remission, we don't want to dive too much into it, as many of you are probably already very familiar with everything that you've gone through. Some of the main treatment options with ovarian cancer: chemotherapy, hormone therapy, surgery, radiation, external beam therapy, and brachytherapy. And each of these can have different side effects during treatment and post-treatment. Okay. And then what are those impairments? What can you expect to see with each of those treatments? This slide is very busy, but I want to hone in on the ones that are in bold print. So with surgery, late side effects, the biggest things we can see are going to be that fatigue piece, and then constipation, which I jumped in a little bit late on that last presentation with Priscilla, but I heard her discussing bowel issues and concerns. So that constipation concern, radiation, we can see that fatigue, you can see vaginal stenosis, vaginal dryness, radiation cystitis, so going very frequently, or radiation colitis, so more diarrhea-based issues. We can also see skin changes, scar tissue formation down around the vagina and the rectum because of the different surgeries that you may have had. Other possible side effects from some of our treatments with chemotherapy, some of the platinum drugs that we see have some neurotoxic effects on our tissue. So just how we may experience neuropathy or loss of sensation from those medications. And again, the therapist that you would be working with would have knowledge of the medications and what those side effects might be for you. Some of the hormone therapies that you may have had can increase that vaginal dryness. You can also have some pelvic floor weakness. And then again, you may also see some changes with osteoporosis as well. These are all, again, those long-term, some of those different vascular musculoskeletal changes, lymphatic changes, cognitive changes, cardiac, so chemo-related fatigue. But again, really want to hone in on, for the purpose of this, pain, pelvic pain, and then your urinary, so incontinence issues, frequency issues, urge issues, and then the genitourinary issues and concerns, which Colleen's going to dive more deeply into in just a few minutes. Sorry. And again, just those main ones that we tend to see in the clinic as pelvic floor specialists: the vaginal dryness, overactive bladder, pelvic pain, fatigue, and your pelvic floor weakness. So all these things are potentials to happen because of some of the treatments that you've had. And maybe as you're sitting there in your seat listening, you're thinking, oh, I do have that, or that is an issue. But now what can I do about it? So what can I do to really impact and treat those side effects? And Colleen, I'm going to pass it over to you.
Thanks, Melissa, and thanks for having me here today to talk about pelvic health. So we'll talk about pelvic health and pelvic floor specifically. So in terms of pelvic health, people with ovarian cancer can experience changes, as we just talked about, in pelvic organs during or after cancer treatment. And the pelvic organs that we're talking about can be your bowel, bladder, cervix, prostate in a male, rectum, uterus, and vagina. So those are what we consider your pelvic organs. And in terms of cancer and treatment, what happens with your pelvic organs can look to you like pain, general discomfort, sense of pressure or heaviness, and problems with bowel, bladder, and sexual function. So this can result, when you have these issues, can result in bowel or bladder incontinence, urinary or fecal urgency, pain in the bladder, pain in the rectum, or pain in the sexual organs. Also, we talked about scar tissue here. So scar tissue adhesions and soft tissue stenosis from treatment can also cause pain and problems with the function of our pelvic organs and our circulatory system, including the lymphatic system. So pelvic floor therapist can be part of your cancer care treatment team. The pelvic floor physical therapist or occupational therapist helps retrain organ function and reduces pain in several ways. So one is called biofeedback therapy. A second way is manual therapy, exercise, and then offering education to help you restore your function and reduce your symptoms. So let's talk specifically about the pelvic floor, if you're not familiar with that term. So the health of the muscles, joints, and ligaments in your pelvic region of your body is really important and is a focus of all kinds of different care, specifically in gynecological cancer and specifically in ovarian cancer. So the muscles in your pelvic floor, or the muscles in your pelvic area, are known as pelvic floor muscles. And these muscles expand from your tailbone in the back, so at the bottom of your spine, to your pubic bone in the front. And these muscles provide structural support. And the strength and function of these muscles is what helps our bowel, bladder, and sexual function, and even our posture. So this is a picture. And in this picture, a picture of the pelvic floor, and what I like to point out here is that red band across the bottom where that purple arrow is pointing. So that's your pelvic floor. And you can see in the very front, it attaches to the pubic bone, and in the back attaches to the tailbone. And this pelvic floor in any person, male, female, even a child, is 3 layers deep with about 5 muscles on each side and each layer. So you really don't think about this group of muscles, but there's 30 muscles that sit at the bottom of your pelvic organs. So you can see the bladder in yellow there, and the urethra goes through the pelvic floor in order to empty your urine. Thank you, Melissa. And then your uterus in the pink there, and the uterus comes through that pelvic floor in what we call the vaginal opening or the vagina. And then that third organ there is your bowel. So that's in gray. And your bowel also exits at the rectum and the anal sphincter through the pelvic floor muscles. So imagine if that sling of muscles is too tight or hard, how difficult it would be to get anything in or out of those structures. And if that group of muscles was super weak and kind of just, didn't have a lot of tone to it, you can imagine how difficult it would be to keep everything in, right? To keep urine in and to keep your bowel movements inside of you if that tone was really weak. So that's just a great picture, kind of giving you an overview of what the pelvic floor looks like. And then if we go to the next slide, you'll be able to see the pelvic floor in a different position here. So on the left-hand side, we're looking down into the pelvis, and you can see what those pelvic floor muscles look like and how they attach in the front from the pubic bone and in the back to the tailbone. So it's like a sling of muscles, and they go from one butt bone to the other butt bone. So it's almost like you're wearing a big pad, right? That's how we would explain the pelvic floor. And if we look in the picture to the right, that picture will show you if we're looking up underneath, like if you were looking up under a skirt, this is the view you would have of the pelvic floor, right? And so again, you can see the layers of muscle, and you can see how the muscle interdigitates with the hip muscles, right? It also, and this picture doesn't show it, but it interdigitates with the back muscles. So all of it's very important to how your body functions as a whole. Go ahead.
Colleen, there's a question. I don't know if we want to.
Oh, sure.
Yeah, there is a question. How long after surgery do we experience pain for? My hysterectomy was in October of 2022, and I still feel pain.
So we're going to talk more about pain coming up, but pain, at any time you experience pain post-operatively, like there's the post-operative period where you may have some pain, so maybe a couple weeks. But in terms of long-term pain, that's a long time that you're talking about. So I would say you're a good candidate probably for some type of pelvic floor therapy. But we're going to talk about pain a little bit more, and that might answer some of your questions. Any other questions right now? Okay, so
There is one more. So no fun, lower quality of life wearing compression garments. Is lymphatic massage enough to keep fibrosis from developing when you have pelvic lymphedema? What are the signs and appearance of fibrosis? I can partly answer the question too, Colleen, and I guess you can fill in where I miss out.
Sure.
Lymphatic massage is definitely not enough. So along with lymphatic massage, you do need the some kind of compression, probably some kind of like a good garment, which could help with the fibrosis. And yeah, what are the signs and appearance of fibrosis? Do you want to take that one, Colleen?
So with fibrosis, sometimes pain. I think the thing that we see most commonly are things like difficulty with urination, or difficulty like with intercourse or an exam, feeling discomfort or pain. Again, we work on that. And I think what Rita just mentioned is exactly how we would, kind of put you into those specific like lymphedema treatment, wearing garments, but also forms of scar massage, exercise, even an eating plan, stretching plan, all of that is part of that big picture. Did that help? Okay. So in terms of the pelvic floor muscles, if we look at the bottom of this picture here, we can see that pelvic floor at the bottom. So the pelvic floor works in concert with what we call the core. So our presenter previously talked about those core muscles and how important they are. And they certainly, how well your core muscles are working certainly influences your pelvic floor. And so in terms of this picture, it's kind of showing the 4 groups. So we're going to say the pelvic floor at the bottom. And then there's the abdominal wall, which we discussed with the last presenter, right? And so that's a group of 4 muscles there. At the top is your diaphragm. So that's your breathing muscle. And we did some of those exercises with the last presenter and used that diaphragm. And then on your back is your back muscles, or we're going to call them multifidi. So those 4 groups of muscle have to work together, and we can relate that to a soda can, right? If you imagine that the top of the soda can is your diaphragm, the bottom is your pelvic floor, the front is your abdominal wall, and the back is your back muscles. And think when you're like 18 years old and everything's just kind of perfect, right? And no dysfunction going on, no poor posture, everything's just great. Your muscles are working together. And then you start to have children, or you have surgery, or you gain weight, or you have an injury. And that pelvic floor, the abdominal wall, the back muscles, and the diaphragm get some lack of balance between them. Sometimes they get really weak in certain spots. Sometimes they get tight in really certain spots. And so that creates this dysfunction. And it almost, if you think of a can, it crumples the can. So you might have like an indentation. A good example of this is when you get a hernia. So a hernia is basically, you've lost that core, you've got some kind of pressure that's going on that's pushing out against the abdominal wall or against the pelvic floor. And so always think of this can and how you want to keep that pressure normal. That's one of the things we work on with therapy. I'm going to have you advance there. All right, so the pelvic floor has 5 main functions now that we know where it is and we know what it looks like. So the pelvic floor provides support for your organs. So as we mentioned, it holds everything up inside. You can imagine as gravity builds throughout the day, the more you're on your feet, the more you're upright, the more downward pressure you have on that pelvic floor. And so that pelvic floor's job is to maybe tighten a little bit or hold your organs up and in place. So the pelvic floor also provides stability. So it makes up what we just talked about, that core, and it stabilizes our pelvis and our lower back. So think of when you see somebody who has poor posture and maybe they kind of limp along, they probably don't have a good core, and their pelvic floor probably has a lot of extra stress on it because of that. And then sphincteric function. So we talked a little bit about this. So your pelvic floor muscles are the muscles that control the opening of the urethra where your urine comes out. They also control the opening called the rectum, and that's where your feces or gas will come through. And the pelvic floor muscles will prevent the leakage of urine, feces, and gas if they're intact, well coordinated, and well controlled. And then the next thing is sexual function. So the pelvic floor plays a role in orgasm. So when you have an orgasm, it's basically those pelvic floor muscles contracting and relaxing. And then if the pelvic floor muscles have, they're too tight, they're have some scarring, anything like that, the orgasm or even even intercourse itself can be very painful. And circulation. So the pelvic floor muscles act like a sump pump. They basically contract and relax. Think when you're outside walking, and this is why we call walking one of the best exercises for pelvic floor. Those muscles are constantly contracting and relaxing as you walk. And so they're pumping the fluid, both the blood and the lymphatic fluid that sits kind of at the bottom of your core. All right, so how does cancer affect pelvic health? Because cancer affects hormone systems, it can affect bowel, bladder, and gynecological systems and change the way that the pelvic floor muscles work. The pelvic floor muscle function can also be affected by some of the medical interventions or treatment that you have, including surgery, chemotherapy, radiation. We already talked about hormones. So pelvic floor changes commonly related to cancer treatment, and this is specific to more gynecological cancer as a whole: bowel and bladder unwanted leakage, urinary and fecal urgency or frequency, constipation, pain or difficulty with sexual function, pain with penetration, painful or tight scars in the pelvic region, and swelling in the pelvic region, abdomen, or legs, and pain in the pelvic region with activity, specifically like exercise, walking, or even just moving in bed.
Colleen, there is a question. The orgasms aren't as good or powerful anymore. Can you speak to that?
Can you say that again, Rita?
Yeah, the orgasms aren't as powerful or good anymore. Can you speak to that?
So get this complaint a lot, actually. And so think about when your muscles contract, they need to contract as a unit and tighten. And then when they relax, they need to completely let go, right? And when your muscles don't have, so those pelvic floor muscles, when they're not well coordinated, when they're not controlled, when they don't have good power, and I'm not going to call it necessarily strength, but when they don't work well, your muscle fibers, when they contract, kind of slide over each other to contract. And then when they relax, they kind of go back into position, right? And when you start to get a contraction, but it doesn't completely happen, and it just kind of gets stuck, and you don't have a good orgasm. I hope that makes sense. And then when you go to relax, sometimes you have difficulty relaxing, and you may feel some discomfort or pressure or heaviness in the pelvic area, anywhere from like an hour after intercourse up to 3 days. It's not uncommon. But just because it's not common, or sorry, just because it's common doesn't mean it's normal. So that was perfect timing for this slide. We say that with so many of these symptoms, just because everybody experiences it and it's Everybody talks about it. It doesn't mean it has to be that way. So what we do is we treat those pelvic floor muscles. We're going to talk about this a little bit more, but we treat those pelvic floor muscles through basic exercise, stretching, breathing. Breathing is honestly the most important exercise you can do, as mentioned in the last presentation. So getting those muscles to first get some kind of coordination. Once they're able to coordinate, to be able to control them with your brain, so selectively engaging those muscles. And then third, to give them a little bit of power, or what we would call strength. Okay. In terms of treatment, so one choice might be electric stim. So this is what we call a TENS unit. You're probably familiar with this. If you've had any other kind of orthopedic injury, they'll use this. We use it in pelvic health as well. And the way we use this is multifold. One way we use it is with any kind of urinary urgency, bowel urgency, urinary frequency, pain, anything like that associated with bowel and bladder. We can even spasms in the pelvic floor muscles, right? When they're not fully contracting. We use this on the tibial nerve, which is down around your ankle. And we'll put the electrodes down around the ankle so that it stimulates the nerve that runs up. So that's the most superficial point down around the ankle. We'll stimulate there so that the stimulus that's a very kind of relaxed, slow-paced stimulus that you barely feel, that will travel up into those pelvic organs and cause them to relax and cause a stimulus that decreases the irritation of the nerve so that the pain starts to diminish. The effect the first time usually lasts about 24 hours, but the frequency, so the more we put that unit on, the greater the effect that happens over time. So usually it takes a couple sessions until you really feel like, the pain is much less and your function is much better. We'll also use a stim unit like this, a TENS unit, maybe over the lower abdomen or over the lower back, where the nerves that deliver those pain sensation or even spasms or cramping, will use this stim to kind of calm those nerves so that it reduces the symptoms. Next slide, please. All right, biofeedback. So biofeedback is a way for us to actually look at what's going on the pelvic floor. The computer screen that you see in this picture here is giving us a demonstration. We have pelvic floor muscles on the right side of our body that are innervated by one set of nerves, and then we have them on the left side of our body innervated by another set of nerves, same nerve but on different sides, right? And so the two sides can act differently, especially post-treatment or post-surgery. And so what we do with biofeedback is we take little electrodes, we put them on your bottom, basically right around your butt bones, and we hook a lead wire up to the computer, and it basically tells us what kind of activity is going on in your pelvic floor muscles. So it's not internal, it's external. It's a way for us to see, okay, do they have really high tone and spasm on one side and it's normal on the other side? Do we see just spasms in the muscles, maybe on both sides? Do we see nothing? Do we see normal? Or do we see a lack of ability to create any tone at all? All of those things are possible. The biofeedback is also a way for us to train you to use those muscles. So we can actually have you look visually at a computer screen and see what your muscles are doing. Here we're seeing a lot of high tone in this picture, so elevated muscle tone. If I had you relax and let go, we should see nothing, right? You've probably heard the word Kegels. So biofeedback is another great way for us to see if you're actually using Kegels. We're going to talk about this a little bit later. So we don't always use Kegels. It's not always the right thing, particularly if you have high tone or if you've been through a lot of treatment. But we can show you how to use your muscles again, maybe get a little bit of coordination going once we have coordination shown on here. So we may have you contract and relax and it kind of makes a waveform. Then we may have you start to hold that waveform for a couple seconds and start to see if you can control that. Once you have control, then we start to work more on strength and power. So next slide, please. Manual therapy. So manual therapy is a way for us to put some hands-on and work on areas where there's maybe scar tissue, spasm, what we're going to call tender points, I think most people will call them trigger points. So those areas of your body where maybe there's some tension and it may be protective, it may be related to the type of treatment that you had, it may be related to fibrosis. There's all kinds of different things that will work with this. It could even, your discomfort that you have may not be related at all to your treatment. It could be related to posture. So like the last speaker spoke about kind of keeping that crunched posture, that can create a lot of discomfort in the upper back, lower back, abdominal area, even into the legs. So we work a lot on posture as well. And when we do manual therapy, it's usually a way to improve your overall mobility, to reduce your pain, and to improve your function. All right, so pelvic floor muscle exercises is another way that we treat. And these exercises are usually designed to improve, like I mentioned, coordination, control, strength, and power of those pelvic floor muscles. And remember, those pelvic floor muscles, when we're working with them, we're also giving you exercises to address the diaphragm, the back muscles, and the abdominal wall. So we could put all of those things together into that core, because if one's not working well, then the whole core doesn't work. Very often the pelvic floor muscles have become strained and too tight. We talked about that. When they're too tight, they're weak and they can't contract, right? So sometimes the muscles need to relax and lengthen. Muscles work best when they are at the right length and not too tight or short. We need them to be kind of stretched and elongated. So sometimes we give you exercises and you feel like you're not doing a whole lot because it's just stretching. But usually, honestly, that's the most important first step, is kind of elongating these muscles, letting them relax, letting them learn how to work correctly, and then we can start to use them to do more what you would call traditional exercise. All right, so other things, breathing exercises, as I mentioned, breathing exercises are actually the key to getting correct pelvic floor function. So you can do all the Kegels you want and all the other abdominal exercises you want, but if you're not doing the correct breathing, they're not going to work right. We want that pelvic floor to act like a trampoline. So if you're sitting right now and you just do this for me, put your hands on your belly, and I want you to keep your chest quiet or still, and I want you to take a breath in through your nose and get that breath all the way down in your belly. So your belly is going to expand as you breathe in through your nose. So your belly and your waist should get wide. And then as you breathe out through pursed lips, you're going to tighten that belly button towards your spine. And when you do that, you should start to feel like those abdominal muscles kick in, that pelvic floor muscle kicks in. And that's just a basic breathing exercise, right? We start you out with that and help you learn how to use those muscles synchronously or together, right? Exercises that promote good posture and enhance postural alignment also reduce the strain on the core and the pelvic floor. So we do a lot of postural exercises, or just even thinking about posture during the day. We have you stand in front of a mirror, kind of look sideways in a mirror, and just get yourself in good alignment and figure out, okay, where am I not in good alignment, and how can I correct that? How can I focus on that? Sometimes that means putting like a little heel cushion in one shoe, just to kind of shake things up and alter your posture a little bit. Sometimes that's enough to get things working. So correct posture is always important with these muscles. And then cardiovascular exercises, as we mentioned, that sump pump action, the walking that actually helps move that lymphatic fluid. So we talked about that a little bit, and gets blood flow moving, right? The more blood flow you have moving, more oxygen, the more oxygen you have, the more nutrients you have, the better the tissue heals. And then these exercises will help to improve your bowel and bladder control, sexual function, and your overall quality of life. So strategies, if I'm talking about seeing an ovarian cancer patient who maybe has gone through treatment, these are some of the strategies I might employ. So I'll talk about correcting any faulty breathing patterns and making sure that your breathing is you're doing some good breathing exercises and that your breathing is helpful to what's going on. Maybe some manual therapy techniques like we showed earlier. The myofascial techniques, which is a form of manual therapy, we're actually kind of stretching and relaxing and reducing tissue tension or reducing tenderness and points in your body that are what we call trigger points. And then addressing musculoskeletal dysfunction. So looking at that posture, trying to correct what's going on there, looking at your toilet posture. So how you try to empty your bowel and bladder can be meaningful. You've probably heard of something like the squatty potty. So if you strain with constipation, you're putting a lot of pressure on that pelvic floor. And what we can do just by elevating your knees above your hips is really reduce that. So the squatty potty or stool at the toilet, when you're trying to go, put your feet up on a stool and it reduces that constant pressure, helps you empty much more easily. And then graded exercise. So that's really the traditional exercise that you hear about all the time. I'm going to have you go ahead. So a treatment plan. Again, if I was writing a treatment plan to your physician, I would talk about breathing, posture, flexibility, that's that lengthening those muscles, some strength training after we got the right control and coordination of all our muscles, some range of motion exercises, which is basic movement, like moving around, up, down, out, all kinds of exercises, adding some light resistance. So we could use a ball like this for resistance, or we could use weights or a band. There's all kinds of different ways. Even our own body weight is a great way to get resistance. And then some cardiovascular exercises. I always put all of my pelvic health patients on a walking program. And if they can't do walking, I have them do some kind of movement in place. But that pumping action is super critical to the way the pelvic floor performs. And it's also super critical to lymphedema and just blood flow. You know, when you have surgery, your blood flow to that area is compromised. It's sometimes more static or has a lot of stasis to it. So we want to get that pumping so that we're getting new oxygen and good tissue regeneration there. And then some manual therapy, and then probably some scar management, depending on how the scar is doing. All right, so I thought there's two most commonly things asked with my patients that I've treated for ovarian cancer. One is urinary incontinence. And so I thought this was interesting that up to 34% of women treated for 3 types of gynecological cancer, so that would be cervical, endometrial, and ovarian, report urinary incontinence. And then the other point with this study that I'm referring to was that people can be trained in how to do like Kegels or pelvic floor exercises with verbal instruction or reading something or being online. But what they found in these studies is that 51% of women who had verbal instruction performed incorrectly. So that's actually not helpful in the long run. And that's the reason we use things like biofeedback and actual evaluation and training with physical therapy, is to make sure that you're doing the exercises correctly, and also make sure that you're not doing something that would hurt you. So a Valsalva maneuver is when you hold your breath and you increase the tension on that pelvic floor and your abdominal wall. And so also in this study, they found that 25% of the women with verbal instruction were still doing a Valsalva maneuver. And so again, working with a therapist would teach you how to avoid that maneuver, because in the end, holding your breath is just going to make the problem worse and not better. The other thing I wanted to point out, that there was a systemic review, which means they looked at everything in 2010, so a little bit old, but they compared pelvic floor muscle training versus no treatment for urinary incontinence in women. And it suggested that pelvic floor muscle training should be included with conservative management for all women with regard to stress, urge, or mixed incontinence. So the second most common thing I see or have a question about is painful intercourse. So the medical term for painful intercourse or any kind of intimacy that's painful is dyspareunia. And so dyspareunia, the way we treat that, everybody always asks, one, just education, just making you aware of what the pelvic floor is, how it works, how it reacts, and what we can do to correct the way that it's reacting for you. 2, consultation with lubrications. So the type of lubricant you're using is super important. You want to have something that is pH balanced, that has no alcohol, like KY jelly is all alcohol. Have something that is paraben free. Coconut oil is usually a good recommendation, but we have a lot of other ones as well. And then position modification. So sometimes the position that you're in when you're having intercourse or intimacy is the reason for the pain. And that can be due to a tight pelvic floor muscle. Now that you've seen all of those muscles inside that you probably didn't really know you had, you can see how modifying your position may make you feel better. Also, just doing the right kind of stretches to release some of those tight muscles or scarred muscles may help. Use of vaginal dilators. So if you haven't heard of a dilator looks like this picture here, and a dilator is basically a way to work incrementally into expanding the vaginal canal or even the rectum to kind of get it to open up a little bit, but to work from the very smallest, like the little purple dilator, all the way up to wherever you're comfortable. It's a way for those people who can't tolerate vaginal exams or even rectal exams to be able to work their way towards that. So we teach you how to use a dilator and give you specific instructions so that you can progress with that process. They seem really simple, but extremely effective. And so vaginismus is one of those conditions that we typically will use this with as well. We see vaginismus a lot post-surgically. Vaginismus is basically when your muscles in your pelvic floor are spasming because they've been through a lot and they're protective. So instead of letting anybody enter the vaginal or rectal canal, they kind of, specifically in the vaginal canal, will push everything out and away. So people will talk about this, like if they try and wear a tampon, or if they try to have any kind of intimacy, or if they try to have an exam, their muscles just kind of revolt, like they want you to stop, right? And so it's painful, uncomfortable, and difficult to understand what's going on. And then just pelvic floor retraining overall. And we talked about biofeedback with that. So in summary, pelvic floor dysfunction can happen to anybody. That you haven't had to go through any kind of treatment or cancer diagnosis or any kind of hysterectomy or anything like that. Can also happen regardless of gender. So pelvic floor dysfunction happens in males, females, and also in children. So we have plenty of children who are bedwetters or who have constipation or other issues. We see them as well. Can also have symptoms related to urinary incontinence, pelvic organ, what we call prolapse or heaviness or pressure, pelvic pain, bowel dysfunction, and other things. So all kinds of different things. Pelvic floor physical therapy can be an effective conservative treatment. So that's really the primary reason we like to advocate for that, and we like to increase access and awareness. So hopefully we can help you with some of your current issues. And if you have any questions, I'm happy to answer them, or Melissa can answer them as well.
I think the other thing I just want to summarize too, just our hope as cancer rehab specialists, pelvic floor specialists, is just knowing that at any point in your care is a great opportunity to reach out to one of us. So we've seen patients as early as what we call prehab, before you've started treatment, you've just been diagnosed, see some patients in the clinic, get your baselines. What is your status functionally? How are things working prior to beginning any of your cancer-related treatments? We may see you right after surgery if you're dealing with any issues, concerns, or it may even be years later that now you're seeing some of the long-term effects of some of your cancer-related treatments. But we look at that prehab, that acute cancer care, cancer rehab, and then again, ultimate goal is getting you back to whatever level of fitness that you want to be a part of, okay? Not looking at acute cancer care, then just jumping into everything. We want to make sure your body is capable of doing the things that it needs to support you.
I would like to add just one thing. So basically pelvic health is one of the things we treat. I want to be clear, we do like a comprehensive evaluation when you come in, and our job is to provide a holistic approach. We kind of find out all the impairments you are having due to cancer-related treatment, and my team touched on them beautifully. Just to name a few, chemo-induced peripheral neuropathy, numbness and tingling, fatigue, weakness, endurance, pelvic health, cognitive fog, name it, we treat it. And basically we are in about 26 locations in Southeastern PA, but also all across the country, 20 states. The goal is to keep you healthy and functional during the treatment, starting from diagnosis all the way through survivorship. We would like to be by your side, helping you navigate all these side effects so that you can tolerate your treatments better and have a great, successful outcome.
Wow, that was such a great informative presentation from all of you, Melissa, Colleen, and Rita. I know that there were some questions answered, but even as I was listening, going through it, again, everything is working together with the information that is being shared today. Michele started us off talking about constipation and diarrhea, and then Priscilla came in and talked about, strengthening the core that helps the pelvic floor. And then this presentation just kind of brings everything together. So to our members, I'm sure they are definitely digesting this information. There was a lot of great things in there, and do just want to open that up to see if there are any additional questions for our panelists today, because again, the information is great, and I would love to be able to share the slides, as you mentioned, with anybody who may find that helpful. But just wanted to give a few minutes to see if there are any questions, if someone wanted to come off mute and ask any questions of our panel today.
Hi, I'm on the phone. I'd like to ask a question if possible, please.
Sure.
Hi, how do we know which physical therapists are actually, I guess, qualified to treat us? Quite honestly, the doctors don't really refer. And unless I'm educated, and I find that my education through programs like this and support groups and whatnot have made me ask questions when the doctors aren't really forthcoming. Oh, you have lymphedema, you need to get treatment. Oh, it would benefit you to do this, that. In physical therapy, often, obviously they're doctor affiliate, they're hospital affiliated ones and whatnot. What should we look for in finding therapists that are trained enough to deal with our?
So I can take that question, and then Colleen can add on to that. But what your question should be, are you trained in oncology? You should be going to a therapist who has some kind of cancer background, hopefully certified like our team is. And if that is not the case, I would highly recommend that you do not go there. As far as we are concerned, I could be the resource, and I have a great connection with the entire Southeastern PA and the whole nation. So I can easily find the best location for you. We make life really easy. We have a central scheduling number, and we just have one number, and that's where you call, send the referrals, and we find the closest location based on what your needs are. So if it is pelvic health, I know all the locations which offer pelvic health. Colleen has a list of therapists who are certified in pelvic health, like Melissa is, and then that would be the location we would recommend. If it is lymphedema, then again, I would be the person who would know that, because that's kind of part of my job description, but it goes to central scheduling. They're given all the information, and they will direct you rightly, or they will ask me for a consult. But oncology therapist, pelvic health therapist should be a question. If there is no, I'm not saying that you have to go to us, but my primary question is, are you certified in oncology? Do you treat cancer patients? And do you have pelvic health, someone who is certified in pelvic health?
Yeah, thank you. Because I know with my surgery, I had some reconstruction. So I have a what they consider a neovagina. So when I heard that they do internal work, it kind of kept me away from following through with some pelvic floor therapy, because I was concerned about that and have bleeding just with exams. I didn't want someone who may not be, familiar with that type of situation doing work that might not benefit me.
I totally agree. Like the outcome can be drastically different, as Colleen can tell you more on pelvic health, of course. The second question right there was, is it covered by insurance? Yes, it is. So that's another, we as NovaCare, because we are so big, we accept everything from Medicare to Medicaid. So, and we verify the insurance before you even go in. Because it's a specialty service like physical therapy is, there would be the standard copay. But again, there are plans in place. So do not shy away from asking your provider, do you have financial plans in place? Like sometimes it can be copay deferment completely based on your financial status, or it can be paid in installments. And if it's Medicare, Medicaid, there may be no copay. If you have been receiving a lot of treatments, you might have met your deductible. So don't shy away from getting the help. The next question was, where is Colleen located? Colleen, where are you located exactly?
So I'm in Mechanicsburg, Pennsylvania. But I currently don't see patients right now. So if you're asking for that purpose, I don't see patients. Lots of other people, very qualified, very well trained. We have, in terms of revital therapists, I'm not sure the exact number. In terms of pelvic health therapists, we have more than 300 across the country.
Revital in Southeastern PA, we have 30 plus, and it used to be 26 locations. I have 3 more therapists, so now is 28 locations, 29 even. All across, there are 20 states which offer, and it's even more widespread in those states. Revitalcancerrehab.com would be the best bet.
Wonderful. That's such great information. Are there any other questions? Just checking in the chat. And I don't see anything. Well, I really appreciate you all being here with us today. Rita and Colleen and Melissa, such great information, and the contact information is there. You can certainly reach out, as Rita has invited you to do so, and she can certainly connect you with, who's going to be good for you in your particular area. But this is the type of information that we want to bring to you, so that if you do have questions, you know who to turn to. So again, ladies, thank you so much for being here and educating us today. If you could share that slide deck with us, that would be great, and then I can send it out to our community. That would be wonderful. Thank you so very much, and lots of thanks in the chat for you. I appreciate it.
Thank you, guys.
Thank you so much. It was our pleasure.
Wonderful. Have a great rest of the day. That was great. And let me just spotlight and remove Colleen. Perfect. Okay, wonderful. Good. I hope you enjoyed that. Some really, really great information. And again, you're hearing how everything, I just said that, but you're hearing how everything kind of just works together with the information that is being shared today. And, as we said in the start of the program, when we're delivering this type of information, it may make you think of other suggestions or other topics that you may want to see going forward. So please continue to think about that and let us know what you want to know more about, so that we can bring you that type of information for future programming. So wonderful. So next we are going to talk to our Clarity organization, and they're going to talk on navigating the ovarian cancer experience. And before I bring them on, I just want to read a little bit of background about them as well. We have a panel of 2 for this, Susan Hess and Mette, I believe you pronounce it, Buhl. But let's start with Susan. So Susan joined Clarity's Steps Thru ovarian cancer team in 2018, is currently Clarity's Director of Education. She meets with Clarity participants individually to provide general ovarian cancer education, and she manages the extensive library of information and resources. She's a licensed professional counselor in Colorado with a master's degree in transpersonal counseling, psychology, and music therapy. Seeing a need to advocate women with ovarian cancer, in 1998, she began facilitating weekly ovarian cancer support groups. And in 2005, she co-founded the Colorado Ovarian Cancer Alliance. In the past 25 years, Susan has facilitated with over 1,000 ovarian support groups and has spoken with many hundreds of women managing the ovarian cancer diagnosis. She has developed Clarity's phase model of ovarian cancer experience and supports women and caregivers in issues surrounding the body, mind, emotion, family, and spirit. And that's going to be Susan. I'll bring her on screen in one moment. And then we have Dr. Mette Buhl. And Dr. Buhl joined Clarity Foundation in 2016. And as the Director of Science and Clinical Trials, she meets with Clarity participants to provide individualized scientific education about standard treatments and clinical trial options. She also monitors scientific and clinical developments in the ovarian cancer field and communicates updates on a regular basis with a Clarity blog. Dr. Buhl has more than 20 years experience in basic and translational cancer research in Europe and in the US. And prior to joining Clarity, she was a fellow at the UCSD Moores Cancer Center at the University of California, San Diego. Prior to that, she was a senior scientist at the Department of Hematology, University Hospital, Copenhagen, Denmark, and the co-founder of CLLU1 Diagnostics. Dr. Buhl received her Ph.D. in chemistry from Aarhus University in Denmark. So we are certainly glad to have them with us today. And I'm just going to bring them on screen with us and invite them to share their presentation. There's Dr. Buhl, and let me get Susan up. Here we go. Wonderful. Thank you so much for being with us today. Dr. Buhl, I haven't had a chance to meet you. Susan, we had a great conversation not too long, but thank you guys both for being here and sharing your expertise and your knowledge with our members today. We're so excited to have you.
Thank you. Oh, thank you. Yeah, thanks so much, Melissa. Go ahead.
You're welcome. Good. So I am going to let you get started. And Susan, I believe you have a presentation to share, and you will have the access to share your screen.
Yes. Yes.
Wonderful.
All right. So good to be here. Just thank you. So good to be here. We're going to go through the slide deck to start with. And let me play here from the start. So what we're working with is navigating the ovarian cancer experience. And this is a program. Clarity provides support in scientific, educational, and counseling. And we like to be able to really address the whole person. And in my working with women over the years, as Melissa said, I found that there were some similarities between everybody's experience. So what we want to start with is, let's get this going here. We call it navigating the ovarian cancer experience. And what does that mean? I have found that, again, that there can be this question of like, where am I? What do I need right now? What do I need to do? There's so many different things. There's so many different directions to take, so many different ways to address this, that it requires knowing the territory to a certain degree. Thus the image here of the landscape and the compass, like, where do I need to go? What do I need to do? So at Clarity, we have developed what we call the OC roadmap. And this is the phase model that was referred to. And this phase model looks at the whole experience, maybe from a step-by-step, but at the same time, across the circle. It can be looked at going around the circle, but across the circle. That these are some of the major areas that we have found that women have to deal with once that diagnosis comes in. So it lays out the territory a little bit so that there's that opportunity to kind of have an overview, a broader view of what is going on. So when we look at this phase model, what we look at is, if we're starting with the crisis of diagnosis, then that is when that ovarian cancer diagnosis comes in. And at that point in time, it can be really shocking. It can even create what we call traumatic stress. It can be a traumatic stress response right at that point. But at crisis of diagnosis, we're really saying, all right, That's when the information comes in. There is then deciding about getting into surgery, most likely. There's going through surgery, there's getting everything prepared for that, and then getting after surgery, having to recuperate from all that. And the whole thing can be just very overwhelming. With that initial sort of impact of the shock of diagnosis can come that sense of, I can't even figure out what I'm just overwhelmed. There can be just that sense of not knowing what, just overwhelmed. Let me just call it that. So after that period of time, and at the same time, the family is usually going through some of the same kind of shock, because the experience of the diagnosis, isn't just for the woman. It's happening in a sense with everybody else too, in terms of this big experience. So after the crisis of diagnosis, when things start to change is when a treatment starts. So many women with ovarian cancer start the treatment of Taxol and carboplatin. And whatever regimen it's usually happening over a period of time, weeks, months, especially with a 6-month kind of protocol. So there can be a bit of a settling at that point, getting settled into a routine of going to chemo, dealing with side effects, going through the treatment experience. It's a little bit more settled than the crisis of diagnosis, but it still isn't the same as before, and by any means. And at this point, though, there may be a little bit more capacity to say, okay, I need to learn a little bit more about this. Maybe I need to learn about the treatments themselves. Maybe I need to learn more about side effects and how to handle things, which is just where Unite for Her comes in so beautifully, just how to do, what do I need to do here at this point in time to cope with the treatment experience. So there can be a little bit of settling and a sense of, okay, I'm ready to learn more. I can learn more at this point to get through the rest of chemo. Then at the end of that period of time, when chemo ends, there's kind of a branch there too. Many women, they finish chemo and they can go ahead and be done with chemo. Other women may find that if they're platinum resistant or refractory, they didn't have a good response to the chemo. But in either case, it's coming to the end of one sort of phase of that first round of treatment. And, many women I've spoken to have said, I thought I was going to be really happy that chemo ended, but I'm not really that happy. Yes, I'm glad that that's over, but I'm not sure. I feel really very, very emotional. And this is true again for women that are done or maybe going into a different type of a regimen of treatment. And essentially what has been happening is that to get through the crisis of diagnosis and coping with treatment has required really kind of not going deeply into an emotional experience or processing, because there just isn't the kind of energy available to do much of that, especially as you're recuperating and going through treatment and everything. This is also a place or time when you as the survivor patient might be starting to be on a different page than your family and people around you that know what you're going through, because they have the energy. They're not dealing with anything physically, so they have the energy to begin to process some of the emotions that have gone on with it, but you haven't. So this transitioning to a new normal is this phase of taking time to realize that you may feel some losses, you may feel some grief or sadness about things that have changed or that you've lost in personal identity that's been going on that you've had that you feel like you may not have, or just feeling confused about like, who am I now? Now that I've had this diagnosis and I've gone through all of this. So this transitioning to new normal phase takes a little while, and it's learning how to look at those emotions, accept those emotions, process those emotions. So when we get through that phase, then and that takes a while usually to do that. And then getting to the next phase, which is called managing uncertainty, where it's like, okay, I've been through a lot of this. I kind of have a sense of who I am and where I'm going now with this. But with ovarian cancer, I think we all know that there can be this underlying fear of recurrence, because the recurrence is present sometimes there in the ovarian cancer experience. There's a high incidence of it. Hopefully you have not recurred, but if you have, that is not unusual. So there's this ongoing underlying fear of recurrence, and how to manage that uncertainty. That fear of recurrence kind of goes along with the brush with mortality. And how is that addressed and handled over a long term? So at that point, it's like, well, then how do I want to live my life? Because when we're dealing with uncertainty, we can't really deal with it in the past or in the future. The best time to deal with uncertainty is right now, right here in the present moment. And how do we manage that? And how do we say, how do I want to live my life? How do I want to live it today? And then how do I want to bring that forward into all my days going forward? So this is our phase model. This is what we kind of work with. I will say too, is that at that beginning point of crisis of diagnosis, there can be, like, oh, I have to figure out all my treatment and I have to learn everything all at once and I have to process my emotions and I have to deal with this anxiety, all of this managing uncertainty all at the same time. That's how it can be overwhelming. And that's how it can be kind of a traumatic experience, because a trauma is something that's so big that you can't really digest it all at once. So this helps break these down into pieces and say, all right, even if what you're really dealing with at crisis of diagnosis is just managing the uncertainty, let's do some things at the point of crisis of diagnosis to get some skills going and get skills going in each one of these areas. So that's where then we look at what skills are we looking at? We're looking at stress reduction and management in the crisis phase. We're looking at balanced decision-making in the coping with treatment. How to say, all right, I have the choice between doing this and this and this and this alternative, or complementary therapy, or this and this and this. Maybe I want to look at a clinical trial now. How to make a decision? How is that? How do we do that? And so that's what we look at in that second phase. Transitioning to a new normal is how are you processing emotions? How do you do that? How do you identify what emotions you're actually experiencing, and how do you process those? And then working in managing uncertainty, finding meaning and purpose and legacy in all of those in that arena. So each of these is kind of developing these kinds of skills, these different kinds of skills from a body-mind perspective. So, and in doing that, it can help actually, increase learning about how to live a life of balance, how to develop more resilience, how to develop even more compassion and insight into one's life. So, it can have the benefit of developing more personal insight and understanding. And not that it's that this would have been the way that you'd want to do that, but it still can wind up being that as a part of the experience. In addition, so we work with all those things in Clarity with our Steps Through a C program. In addition, in our library, we have all sorts of information about the real specifics. So, distress of diagnosis, or weighing fertility options, or travel and lodging, chemotherapy management, palliative care management, fatigue, sleep, sexuality, spirituality. So we know that this experience covers a lot of the person. So we call it the whole person experience, that it's body, mind, emotion, social, and spirit that everyone's having to deal with. And in that, what we want to look at and talk about a little bit more in depth than today is the body aspect of this. So how do we deal with, how is it best to deal with some of the aspects of supporting the physical experience? So with that, what I will do is I will introduce Mette, my colleague, Dr. Mette Buhl, and she will talk about clinical trials as our Director of Science and Clinical Trials. She's going to talk a little bit about getting more knowledge about how to address these physical issues of treatment.
Thank you so much, Susan. Yes, from you could hear from the introduction and from my name. I'm originally from Denmark, but I have lived in the US for a long time now. But I've still kept my accent. I don't think I'm ever going to lose that. Thank you again for being invited to speak today. So yes, I am a scientist. My background is science, and I am responsible for Clarity's scientific work. Where I have a couple of colleagues that work with me, of course. But the Clarity started in 2008, and I just want to briefly talk about actually the background for Clarity. Our founder, Laura Shawver, she is an ovarian cancer survivor herself, and she is a really, really great scientist and a biotech entrepreneur. But when she was diagnosed in 2008, she found that it was actually, even for her, difficult to find the great information to find and to make sure that she got the best possible treatment. So after she went through her treatment, she decided that she wanted to really make a difference. And that's why she started Clarity, because her mission was to improve the access to information and basically also to work to improve the survival and quality of life for women that are affected by ovarian cancer. No, not yet, Susan. Sorry. So from the scientific standpoint, what we can offer, we can provide individualized information, both about standard treatment options, but also about clinical trial options. And we do that really in a very personalized way, because we really can look at the clinical situation, about your tumor biomarkers, and also personal preferences. Okay, next slide. This is a little bit kind of maybe a little bit difficult slide, but I'll try and walk through it, because we have some aspirations at Clarity. We feel there are a lot of unmet needs in the ovarian cancer world. And we think if we can work towards like getting more women access to these things that are mentioned here in this slide, we really think it can make a difference. So I'll just try and explain what we mean. We think and we believe it's very important that everyone receives germline BRCA testing at diagnosis. What does that mean? That means that we believe that all women should be tested to see if they have inherited a BRCA mutation, because that can really be very important to know for your treatment. And we also believe that women at diagnosis should be tested for what we call a tumor BRCA status, and for what we call HRD status. Because again, that can be really informative when you choose what we call maintenance treatment. Then we have also the belief that anyone that is like trying to make a treatment decision should be aware of their options. And in particular, there are clinical trial options. That's not to say that everybody should necessarily choose a clinical trial, but we think at any stage of the treatment decision, you should know what's out there for you. And I'm bringing that up because I think we also really want to be part of debunking the myth that clinical trials is just something you do once you have already exhausted all the standard treatment options. I think sometimes people believe I'm just going to go through all the different types of chemotherapy, and then once I've tried everything, then I'll look and see if there's a clinical trial. And that's not really always the best way to think of it. Clinical trials are a way that you potentially can get access to a novel treatment. And certain clinical trials actually also limit how many prior therapies a patient can have had before. So it's important when you make a treatment decision that you can that you are also aware that it maybe makes sense to try a clinical trial at this stage. So that's really also something we want to work for. Finally, we also think that it's very important that women get access to tumor biomarker testing. Again, that can potentially help predict which kind of therapy would be the most beneficial. And for women that have a platinum-resistant ovarian cancer, we think that it would make a lot of sense if they enroll in a clinical trial if they're eligible. And for this last part, there's actually some data that supports this piece of information. At the recently in the SDO meeting that just happened a few weeks ago, Dr. Morton, she's a gynecologic oncologist from Ohio State Comprehensive Cancer Center. She presented information that suggested that women that have a platinum-sensitive recurrence, they may have a better outcome if they enroll in a clinical trial instead of only like having standard treatment options, like using the standard treatment chemotherapy. I do see I'm just like letting my eyes kind of slip over to the chat, and I recognize that there's probably a ton of questions. I don't think I can like answer those right now, but I just want to say already now that we are really, as a resource, we are so happy to have these types of conversations. So if you reach out to Clarity after maybe next week, I'm really happy to try and also address some of these questions. I don't think I can go into those right now. Maybe we have time at the end. Okay, next slide, please. So how do we help? Well, Clarity has a lot of different types of resources. We have a lot of information on our website, which is just www.clarityfoundation.org, where we really talk about basic ovarian cancer terminology. We also talk about clinical trials. You know, what are clinical trials? What is a phase 1, a phase 2, a phase 3 trial? And then we also have our blog. And our blog, we try and share information about new promising treatments, you know, any kind of information that's being discussed in the media, that's being presented at scientific meetings. We try and help share that so people have a chance to stay updated about what's happening in the field of ovarian cancer. And I just wanted to kind of also add in this little figure here, this is our way of kind of trying to explain what does platinum status mean. I think a lot of you probably already know, but the term platinum sensitive or platinum resistant is used a lot when it comes to ovarian cancer. And I think it can sometimes be confusing. What does that actually mean? So we explain that by, in this figure, you can see that you can imagine that someone is undergoing platinum treatment. You know, the very vast majority of women will get platinum with, as Susan also said, as a first-line treatment after they've had their surgery. And we are really kind of interested in investigating in this platinum. We need to try and understand how well has that treatment worked when we need to determine if a new treatment has to start. So platinum status is determined by looking at the very last date, basically the date of the last cycle of platinum you had. And that's what is indicated here as last platinum treatment. If the cancer started growing while you actually were receiving platinum treatment, then that's characterized as a platinum refractory cancer. But if the cancer started, like it had responded to treatment, and then there was a time after that treatment was ended and before cancer could be detected again on a scan, then if this time span is 6 months or less, then we call the cancer for platinum resistant. But if the time from the last platinum cycle until there's evidence of recurrence on a scan is more than 6 months, that's when we talk about the cancer being platinum sensitive. And knowing the platinum status when you have a recurrence is actually a really important parameter to try and help identify what could be the appropriate next treatment. Next slide, please. We also on our website have specific information really regarding standard treatment option according to the clinical situation. So on our website, you will see these symbols. I'm newly diagnosed. If you click in here, you will really be able to find everything about what do the NCCN guidelines prescribe is the standard treatment in this situation. And in the same way, my treatment worked and there's little or no cancer left. That's really a question of what are the best maintenance treatment option. And finally, we also have this icon for my cancer has not gone away or has come back. And if you click on that, you will find information about treatment for a recurrence, both for platinum sensitive or platinum resistant recurrence. Next slide, please. The other thing that we also provide at Clarity is that we provide consultations. And these are really personalized. They're one-on-one. And we do this consultation. Typically, we have a consultation by phone first. And sometimes we have multiple phone conversations. And sometimes after a first phone consult, we also help by email. We do ask if you want to have a personalized scientific consultation that you share your records. We would love, if possible, we really like to see the pathology report from the surgery. And we ask for that because we would like to know for sure that we understand what type of ovarian cancer do you have. We ask about tumor biomarker test results. If you've had any kind of tumor testing done, we would like to see those as well, because those type of results can also be important when you determine the best way forward. A progress note allows us to see basically your treatment history, because it's really important when you're discussing also again what type of treatment you may be a good option to understand what type of treatment have you had before. And finally, we also ask to see a most recent scan report, because one of the things that are important when you also look for clinical trials is understand basically how much disease is present. And that's something that type of information you can get from a scan report. But with that being said, we can really help in many different ways in this conversation. These conversations can be totally, fitted to what you are interested in learning about. Sometimes we really discuss individualized treatment information about what's the standard options. And we also sometimes help women understand their tumor profile report. If you have not had a chance to discuss this in detail with your doctor, we can try and explain in more detail and explain the science behind it and what does it mean. And finally, we are actually able to help identify clinical trials. And that type of service is really something that I often help with when women are interested in looking for a trial that's maybe in a different institution than where they're being treated. Because I often hear that if a woman asks for a trial, maybe a doctor knows what's happening right at their institution, the place where they work. But some women are interested in knowing, well, what if I'm ready to travel to a different city? What if I'm even ready to travel to a different state? Some people are just interested in knowing what's out there, basically. And Clarity has developed a clinical trial search tool, which I'm going to talk about in a moment, that really allows us to look for trials in a very specific way about trials that fits you, and it also can look for trials in specific locations. And I just want to re-emphasize again that, I'm a Ph.D. scientist, I'm not a medical doctor. And we cannot provide medical advice per se. I cannot tell you what to do and not to do, but we can help you understand your situation and options. And we often also really encourage you to share the information that we provide with your doctor and hopefully have a discussion if possible. Next slide, please, Susan. Okay, clinical trials. I don't know how much, I'm sure many of you already know a lot about clinical trials, but typically we talk about that 3 types of clinical trials: phase 1 trials, phase 2 trials, and phase 3 trials. And any new drug that needs to be approved by the FDA has to go through all these stages. Phase 1 trials are the first trials. That's the first time typically a drug is tested in patients. Phase 2 trials are kind of the intermediate stage, and phase 3 trials are large trials that are really designed to test a large group of women. And then ultimately, if the trials and the results of a phase 3 trials are promising, that's the data that the FDA reviews to determine if a new drug should be approved. So I don't know, some of you may have tried yourself to look for a trial at the site called clinicaltrials.gov. That's, the FDA's site. Every single clinical trial that's available in the United States has to be registered with the FDA, and every trial is assigned a specific kind of identifier. We call it the NCT number. It's basically just numbers, and so we can identify it easily. And the FDA does have a website that called clinicaltrials.gov where all these trials are listed. It can be very overwhelming to try and look for a trial there because there is so many. So my mentor and Clarity's former scientific director, DeStefano, she was really instrumental in creating this clinical trial search tool that we have on our website. And that's also freely available, that you can use it yourself. What we do is that we draw basically all the trials that are listed at clinicaltrials.gov that allow women to enroll into our trial finder. And we keep those updated, with the updates that go through clinicaltrials.gov. So as of last Monday, when I last did my update to this trial search tool, you can see we had 12 phase 3 trials, 134 phase 2 trials, and 474 phase 1 trials that are in principle available for women with ovarian cancer. So many trials out there. There's a lot of good research going on. So at the same time, a large part of my time is also spent at trying to stay on top on what do we actually learn from these trials, because at scientific meetings and also in the journal publications, information about the results of these trials are always being shared. So we want to also stay up on that, so we have a sense of which drugs work, which drugs don't work so well, what's happening, how far along are these trials. So we really also try and like collect all that information. And this is then all built into this trial finder. Next slide, please. So on our website, on the Clarity Foundation website, but thank you for adding it to the chat, you can find this Clarity Clinical Trial Finder. And I'm going to show you how you can use it, but I don't expect you to be able to do that necessarily. I would say many women come to us and help us, ask for help in doing the trial search, because it can be a little bit overwhelming. But I want to just try and explain to you briefly how the trial finder works. So hopefully you understand that. And then if you are interested in having us help, then feel free to reach out. You can, of course, go on our website and give it a try yourself, but we're also very happy to help doing the trial search for you. But generally, the first thing one has to do when you use a trial finder is, again, to kind of choose, are you in a situation where you're newly diagnosed, looking for trial for newly diagnosed patients? Are you looking for a maintenance treatment after you finished your treatment? Or are you having a recurrence? And just for the purpose of illustration today, I chose this, my cancer has not gone away or has come back. Next slide, please. So when I click that, a new page occurs. And again, as it says, select the best description of your current clinical situation. So again, there are different situations. It may be that you have progressed on treatment, or it may be that you had a treatment break, but now the cancer has come back. So I click on the just recurred. Susan, next slide, please. And then comes these 3 bars. So basically, this trial finder allows you to put in a lot of information about your personal situation. As it says up here, you can answer each question as well as you can. You don't need to answer the question. In fact, if you answer no questions and just basically go to the bottom of the search and say search, then you would get the list of all the trials we have. But the more information we can put into this search trial tool, the more specific the search will become, and the fewer trials you will get. So just to illustrate how this search works, I want to enter information about my cancer and treatments, is what I clicked. Next slide, please. So this pulls up a whole lot of questions. And as you can see, the questions have, fortunately, a little kind of question mark here. So if we have tried as much as possible to explain what the questions means. But we really, we really try and basically capture what type of treatment have you already had, and how many different kinds of treatment have you already had, because that is really a very important criteria when you look for clinical trials. And here it says, how long did it take for your cancer to come back after your last platinum treatment? So next slide, Susan. If you click on that question, that actually is the question that tries to have an answer, and in the context of what is your platinum status that we discussed before. So if you progress on treatment, you're refractory. If you recurred in less than 6 months, you're resistant, and so forth. But all of these questions are basically pull-down menus where you can select an answer. Next slide, please. In the same way, in the middle bar, we have a lot of information, a lot of questions about the tumor test. If you know if you have a BRCA mutation, all kinds of questions that really would be typically found in that tumor test report. Next slide. And finally, the last bar is more specific about kind of things like, do you want to look specifically for a phase 3 trial or a phase 2 trial? Are you looking for a trial in a specific state, in a state where you live? Then you can look really in one state, or you can like not fill this out, and then you will look in all of the United States. So again, there are a lot of different choices. You can also really look for specific type of drug. Are you looking really for PARP inhibitors? Then you can do that, and so forth. So lots of ways that you can really personalize this trial search. Next slide, please. So I just wanted to kind of show you an example so you can see how it looks. So in this case, I thought, I'm speaking to a high-grade serous ovarian cancer patient. She has had 3 prior chemotherapies, and now she is platinum resistant. She has what we call measurable disease. I'm not going to go into that today, but that's part of the information we can find if you share a scan with us. And that's also another important piece to actually put into this trial search. She's BRCA negative. She has had tumor testing done, and her tumor was found to have a couple of alterations. She is particularly interested in phase 2 or phase 3 trials in the state of New York. So I plugged all this information into our trial search and pushed search at the bottom. Next slide. And this is just kind of to show you how does a trial search output look. So basically, this search that I just made up actually came up with 25 different matching trials. So they are all listed. I'm just showing you a little part of this list of trials. They'll all be listed to 25. All of the trials, you can see they have this NCT number over here. So that's this identifier that also, if you click on this link, this is a live link, that will actually take you to the trial document on clinicaltrials.gov. Then there's the title of the trial, sorry, and also kind of a description of which patients are eligible for this trial. Our trial search output shows which states have that trial, and then there's more information about what drugs they are. If you click on this view drugs, it can help you understand what type of drugs are being investigated in the trial. And finally, over here, we have the results icon. Next slide, please. So if you click on that result icon, you will actually open this new field that shows results either from that same trial, if there are results already from the ongoing trial, or we basically link to results from an earlier trial with the same drugs, just to kind of get your sense how well does this drug works. And if you even click down here on this view detailed results down here at the bottom, you would even be able to go to those source documents that I use to kind of make this entry. So there's lots and lots of information. In fact, it can sometimes be a little bit overwhelming, but you can dig quite deep to understand more about the different trial options that are out there. You can also use this trial finder in a completely different way, where you don't put anything in about your personal information. You know, I just heard at this SDO meeting that I mentioned before that there was result for a new drug that is also being used in the ovarian cancer treatment. So I was like, well, I'm interested in knowing where can I find the trial with that drug. Then you can really just use our trial finder at the bottom part and specifically just say, I want to find information at trials that actually use this drug. So the only thing I'd filled out for this search was really just to select a drug name and push this search down here. Next, Susan. And then our trial search tool will actually pull up all the clinical trials that are listed on clinicaltrials.gov that study that drug. We also have this feature that if you have trial search output, if you push this little button that says save trials, that will save this list, this trial search output as a PDF. And that can be helpful if you want to send it to a doctor, if you want to share it with someone else. And we certainly, usually when I do a trial search for someone and after having a conversation, I will save the trial search that way and send it as a PDF file, as an attachment to an email back to the person I speak to. So I think this was a lot. I know I covered a lot, and maybe the whole clinical trial search was slightly overwhelming. That's why we offer that we really are happy to help doing that. We can share the link after we have filled it out with you, and then you can change it yourself if you're interested. But we really will walk you through this whole process. It's not that we expect people to be able to do that. And this is just information. If you're interested in having a conversation with us about your specific situation and discuss treatment options, then you can also find that a link on Clarity Foundation. And we have a kind of a little form that we ask you to fill out And then we ask you to send you copies of these different types of records, so we are able to help the best way possible.
Well, thank you, Mette. That's always so interesting to know about the scientific side of it. In the time we have left, I'm just going to quickly go over another aspect of the physical experience, which is the traumatic stress. And our Steps Through OC program, we have 10 OC counselors, we call them, and those 10 OC counselors can help navigate traumatic stress. The stress that we're talking about is the one that happened at the crisis of diagnosis. There can be these sort of symptoms, cognitive and emotional symptoms can show up, the sort of shock, denial, disbelief. There's guilt, shame, anxiety, fear, sad, hopelessness. A lot of that can be showing up, as well as some of these physical symptoms that you might have started dealing with at the beginning and might continue to deal with, like insomnia or racing heartbeat or aches and pains, muscle tension. And just to be clear that this is the traumatic stress, you've probably heard of PTSD, that's post-traumatic stress disorder, but that's all happening because of traumatic stress, which is an automatic response of the nervous system through the autonomic nervous system. Our sympathetic branch of that causes the fight or flight response, and our parasympathetic branch of that causes the freeze response, or can also cause or encourage more of a rest and digest. So we want to make sure that you know that if you're experiencing some of those symptoms, it's because your nervous system is trying to help you. It's saying, oh, there is a threat out there, that this diagnosis is a threat, and I need to be prepared and ready to handle this threat. But if you stay in that threat response for too long, then it just wears out. Your health suffers from staying in that response, and your body doesn't have quite as much of an opportunity to heal, which happens best in the rest and digest response. So, just recognizing where you are in the stress response, the traumatic stress response spectrum can really help you intervene, because the way that you can intervene with the automatic response is with a purposeful intervention. So what we can do is, just to close, we'll just do 3 little quick interventions. One way to intervene with that stress response is to just do some gentle releasing movement. So what I always say is just shake your arms at your sides. We've been sitting here for a while, shake your arms. Another thing is to put your hands behind your head and just lean back and let that breath come into your chest. Oh, yeah, and shaking it out. It's just shaking it out a little bit. That gentle releasing movement. And then we can look at closing our eyes just for a moment and doing some mindful relaxing breathing. If we just close our eyes, take a breath, keep our awareness on the breath, and then let the body relax. All those little micro tensions that have been holding everything tightly. I really appreciate the physical therapy and Priscilla's work on tightening and strengthening. This is also them, but releasing and relaxing and letting the body relax while we are focusing on the breath, so that we're not focusing on the mind and all the things that the mind are telling us that have to happen and we have to do. So just for a moment, taking that breath, coming into the present moment right here, right now, and just shaking out, relaxing. And then from that place, then there's the heart-centered imagery. From that breath and the being in the present moment, just letting our awareness drop into the heart. And I would encourage us to just imagine a beautiful flower there in the heart, a flower that reminds us of our own our own self-compassion, our own beauty, our own inner beauty, our gratitude for all the things that are happening, for all the people outside of us that are helping us through all of our challenges. And that when we drop into that heart center with a sense of beauty and care and compassion, that also helps the body relax and counteracts that traumatic stress response and brings us into the present moment of gratitude. So we can open our eyes again then and know that Clarity's programs include the treatment decision support with Mette, the Steps Through OC program, where we offer 10 sessions over 6 months of OC counseling individually with our OC counselors across the country. I'm offering OC education sessions 1 by 1, where it's just learning some of some of the terminology, and then of course the clinical trial finder tool. So you can contact us. This is our information, and Melissa, I think you'll be sharing the slide deck. And thank you so much for being with us today.
Wow, that was such great information. Again, the resources are so rich for today that you guys have brought together. And I know that there were some, comments in the chat, and thank you for inviting our members to be able to reach out to you to have these questions answered. And, this is exactly what we want to share is this information and knowing where to find it. So the presentation was wonderful. I am going to be very happy to be able to send this out to our members that way that they can reach out to you individually to get their questions asked and answered, I should say. So thank you guys so much. I don't know if there is any just last minute question that anybody may want to come off mute and answer. To ask, excuse me, that would be great. I will allow a little bit of time for that if somebody did have a question. And I see some people are off mute, but maybe not to speak. Okay.
I have a question about OSS. I learned that the FAA became concerned with some too diverse pools and faulty OSS numbers. It seems like a very highly suspect stat anyway, and that they have actually changed their approach to OSS. And there's a lot of discussion amongst researchers about this, but I hadn't had a chance to really delve into it. So I thought I'd just ask the question and maybe get a bit more information if I can about it. There was a particular drug actually that was rejected that was identical to another drug. I think it was a PARP inhibitor. And it was because of the OSS was, too many apples and oranges and peaches and pears and that kind of thing for them to come up with an OSS number. I don't know if you agree or disagree.
Do you know about that, Mette? You're on mute.
When you say OSS, it is the overall
I mean,
survival.
not OSS, sorry, OS.
No, so the overall survival, yeah. So there has been, a retraction of a couple of the PARP inhibitors, in the sense that it's not any longer recommended that PARP inhibitors are used as drugs for treatment at later lines, like after like 3 or 4 prior therapies. And I think the jury is still out. We're waiting for longer follow-up of these trials, but I think it's a precautionary thing that the FDA have decided for now to limit basically PARP inhibitor use to maintenance treatment. I don't know if that answers your question. Now you're unmuted.
Margaret, you're muted.
I'm hoping they will more broadly question the OS stat, because they've made some decisions based on it that are harmful to women. And it has been kind of a bogus stat because there's so many different variables in the pool.
Yeah.
When did they get their cancer? What types of treatments have they had? How old are they? And they've made these grand statements like, well, it doesn't matter if you treat them or not because they're all going to die. And I've heard a researcher who's concerned about this discuss it, and then that the FAA is taking another look at it. They're being more strict about it, but they're still focusing on the OSS. So it's one of my worries.
No, but it is complicated because unfortunately, if you wait also for all survival data, it's going to take a very, very long time before you get access to new drugs. So yeah, I agree that they won't become too kind of restrictive in that sense, because it is a very difficult endpoint.
It seems like they need to educate doctors as to its lack of absolute accuracy or something like that, so doctors understand that it's a statistic.
Yeah, and the people that design
And
the
the gray areas and the ambiguities of the statistic. That's what I'm
Yeah.
saying.
Sure.
Yeah, thank you. Thank you so much. And Susan put her information back in the chat as well. And, you know, we'll end this up with Victoria said that the information about trauma is very appreciated. It felt validating. And she feels like she's at a crisis point for treatment and is looking forward to taking advantage of the resources that you guys are providing. So again, thank you so much. And ladies who are on the call, I do hope that you will reach out to them to get your questions answered and just to learn more and about the clinical trials if that's something that you're interested in. And I love how you said that, you know, for many people think it's a last resource, but it's not. So, you know, take advantage of this information that was presented to you today and just reach out to see how much more you can learn about everything. So this has been wonderful. And I do want to say that this session is being recorded and will be put on our website so that if you need to go back and get any of this information, you know, I will send out the PowerPoint, but it's also be recorded on our website so that you could review it again. So thank you, ladies, so much for being here with us. We really, really appreciate it. You were awesome. And I hope that you will be able to help many of our members here today.
Can I say one more thing? I just want
Sure.
to say the Clarity Foundation did actually save my life, literally. And not only did they literally save my life by making recommendations to my doctor, so he applied for compassionate use of a drug that hadn't been approved for ovarian cancer. Just having them to ask questions and answer my questions made my quality of life good instead of an utter misery. So I'm going nowhere. So I just want to say that.
Thank you, Margaret, for sharing that. That's wonderful. Thank you so much, ladies. And yes, this information is extremely valuable. We appreciate it.
Great.
Wonderful. Have a great weekend. You're certainly welcome to stay on with us for our last portion of the cooking demonstration, but thank you for being here with us.
Thanks.
Sure. Oh, so good. So rich. So full of information. So last but not least, I told you that we were going to bring back Michele, and Michele is in her kitchen and she is going to do a cooking demonstration, which I see she's already has some things started. And Michele, what are you going to make for us today?
So if you remember your cancer fighting kitchen cookbook, so you can break that out. And on page 131, there are two dips. The first one is an edamame avocado dip with wasabi, and the other one is a cannellini Kalamata olive dip. I love dips. I could eat dips every day, especially bean dips. So I thought this would be nice quick recipes to wrap up today, and they're super easy, not complicated. So this will be quickly so we can wrap this up. So I'll go ahead and get started. One thing that I like to do is make my own tortilla chips. So a very simple recipe. You take your tortilla, corn, flour, and guess what these are? These are almond flour tortillas. So if you have a gluten intolerance, these would be excellent. I just found these yesterday, so I thought I'd give them a try, and I tested them and they are so nice and crisp. So I have my oven preheated to 350. I'm just going to lay this right on top of my baking sheet. And actually, before I do that, I'm going to cut it into 4s. So just using my kitchen shears. And I'll pop that in the oven for 5 minutes, flip it, and cook it or bake it for another few minutes. So I'll get this going. All right, so let's start with the edamame avocado dip with wasabi. So I have everything laid out here. So the star of the show is edamame, which is an immature soybean in the pod. So this is, of all the plant proteins, we love plant proteins, so beans, nuts, and seeds. Of all the plant proteins, soybeans, so this is the edamame, have the most amount of proteins of all the plant proteins. So I feel like I've said that 6 times. So in just 1 cup of edamame, there's 18 grams of protein. I mean, that's right up there with your animal proteins. So I'll go ahead and dump that in. Next, I have an avocado. We're actually going to cut 2 avocados and pop them in. If you ever want to know how to choose an avocado, always go with one that is not completely green, not completely black. The green ones usually are like hard as a baseball, so you don't want to select that one. The black ones are usually overripe. I mean, you may like that, and that is completely fine. I'll go ahead and dump this in. This is something I always forget to do before class, is remove the seed and pray that it doesn't fling across the, the kitchen. All right. And another trick to selecting an avocado would be to the little stem at the top. If you can easily remove that stem, then it is ripe. If you're really trying to force that stem out, then it is not ripe. All right, already making a mess over here. Here's my second avocado. And then they're also, they give a little bit when you press into it. Avocados are those healthy fats. So our healthy fats can help us with inflammation. That was pretty good. I'm 2 for 2. Didn't fling that across the kitchen. This food processor is a little bit larger. I have a 2 cup. This is a larger food processor. I just use a basic Hamilton Beach food processor. If you don't have one, you can put your ingredients in a bowl and use an immersion blender, or if you have a really high powered blender, you can do this in batches and use your blender. I'm all about using what you have. And side note too, if you've never attended any of our cooking demos online, I have some olive oil, you should do so. They are open to the public. Here I have some garlic, where one of us dietitians will prepare 3 recipes. So it's usually about an hour-long class, but they're a lot of fun. And we do 48 of them a year, as Sue mentioned, so once a week. I just added some water, and here I have some fresh ginger. I'm not a huge fan of ginger, so I'm not going to put that much. If you want convenience, I'm all about convenience. You can purchase ginger or garlic in a squeezable tube, so you don't have to go through all of this. However, if you like the challenge, by all means. A little trick with ginger, you don't have to use a vegetable peeler. You can use the side of a spoon, and it peels very easily, which is nice. You can also leave the ginger out, or you can use a ground ginger spice. That's okay. Whatever works best for you. Also, you saw me using the juicer. It is completely fine to use the ones that come in those cute little plastic squeezable bottles. Sometimes our strength in our hands might be lacking, or if we have anything else going on. Neuropathy. Bella, get down. Bella, get down. Excuse me. Bella is my dog, who is really sweet, but we just got a new cat, so we're noticing some personality changes because she never would have done that. All right. So I'll pull these out, give them a good flip. I can't believe how nicely these brown, they turned brown. Sometimes with the corn tortillas and the flours, you have to play with it, but these were perfect. And I'll show you at the end how they came out. So this is a microplane. This is a great tool to zest any type of citrus. You saw me do the ginger. You can use garlic as well. So it's a great kitchen tool to have. All right. And oops, let me get some mint in here. I have some fresh mint. If you have an herb garden, I'm sure that your mint has already started to grow. So this was the first time this season that I ran out and grabbed some fresh mint. Just give it a rough chop. I know it's going into the food processor, but some things I still like to cut up a little bit more. Last but not least is my wasabi. So speaking of potty talk, if that is something that is going to irritate your belly, then leave it out, or maybe just use a little bit. If you've never worked with it before, just use a little and taste it. And if you want to go a little bit further, that's the way that I would do it. I bought this wasabi paste in a little tube. There is also wasabi powder as well that you would add some water to it and give it a mix. This is exactly the same type of tube that the garlic and the ginger comes in. So these are great little tubes. You throw them in the refrigerator and they last a long time. So the wasabi is in the same family as the horseradish family. It's from a root, and then it gets ground into this paste or the powder. So this is the first dip. I'm going to lose you for a minute while I get this puree. And it also helps when you plug in the food processor. Melissa, how many times have I done that? How many times?
Often.
How many times? Oh gosh. I mean, I had a few hours to prepare, right? And I forgot to plug that in. All right, so once you take these out of the oven, take them off the pan because they will continue to cook or continue to bake and brown, and you don't want that. If they are a little bit soft, they will continue to crisp as they cool. All right. This is fantastic. Let me try another socket. Oh boy.
It's almost like technology. It works. You know.
I think I promise you our cooking demos go a little bit more smoothly than that. You're probably like, I'll make sure to not take her class. Oh, that's great. Before I show you the finished product, I'm going to move on to the other dip and then I can present them together. So I'll get this out of the way. Oh, it smells so good. And then of course you can add a little bit of salt to it as well. And for this next recipe, this is the cannellini bean with Kalamata olives. I'm just going to use my 2-cup food processor. All right. Honestly, you can use any type of bean for this. The recipe does call for cannellini beans, but kidney beans, black beans, chickpeas, the sky is the limit. All right, and here are my Kalamata olives. And Kalamata olives are salty. All olives are salty, so you really don't need to add salt. I have some garlic here, and that's from the brine. If you were to pick an olive off of the tree, some olive oil, it would taste awful. So that's why they are packed in a brine. I have some water. a little bit of cayenne pepper. So again, if your stomach is not going to handle a pinch of cayenne pepper, then do not add it. I also grabbed some turmeric. The recipe doesn't even call for turmeric, but I thought, why not? Okay, I have some chives. The recipe calls for basil. Here we go. The recipe calls for basil, but I wasn't crazy with the way the basil looked. So I'm just going to add some chives to it. So any type of herb that you have on hand, you don't have to use fresh herbs. You can use dried herbs. And my lemon.
Michele, can you repeat what page the recipe is on?
Yes, it's on 131.
Thank you.
Mhm. If you ever feel like your dip is too dry, then add a little bit more water. If you feel like it's too watery, if you have another can of beans, then go ahead and add that. I would not advise adding more oil. Water is the way to go, or you can use the liquid from the beans if you don't drain it. There we go. All right, almost done. I will present this and you will be on your way. If you are not an olive fan, you do not have to use the olives. Okay. First off, I want to show you how brown and how they hold together. I was thinking, I don't know if these were going to keep their shape, but they sure did. All right, so there is the cannellini Kalamata olive dip right there. We'll just go ahead and use this. All right, and there is our edamame avocado wasabi dip. That is a mouthful, but it's beautiful green color. It almost looks like guacamole, quite honestly. And that is it.
Delicious.
That is it. Any questions for me?
Oh my gosh. That
ahead.
looks so delicious and so easy to do.
So good. Yeah, absolutely. And please join us for our cooking demos. They are now posted in the newsletters that come out monthly. If you can't find them, or if you don't get, is there a particular Melissa, would everyone have received the cancer fighting cookbook in the audience today?
If you have been on our program, you should have received that, but just in case there are some guest visitors, we can certainly send out, in the recap, we can send out the recipe as well.
Perfect.
Yes.
And if you were interested in the cookbook, it is sold on Amazon as well.
You're right. And I'll put that in the chat too. It's called the Cancer Fighting Kitchen Cookbook.
Yes. Yes.
Okay, perfect. Well, if there are no other questions for Michele, I see that Susan is still on, and we thank Susan for being here. Thank you all for being here today. It has been such a fantastic program. The information, like I said, has just been so rich and so robust. I love to see all that additional feedback about clarity. And, this is exactly what we would like to hear. So Susan, I hope that you've seen that feedback in the chat so that you can know how important your organization has been to us. And just thank you all for being here and taking the time out of your schedule to get this information. We do want to say on behalf of Unite for Her, it's only been a couple years since we've been supporting ovarian cancer, and we are very thrilled to be able to support that. So thank you, Michele. Perfect. Cancer
It's
fighting.
Rebecca Katz. Rebecca
Yep.
Katz.
Rebecca Katz. I'll put that in the thing too. But what I was saying is that if you do know of anyone who is living with ovarian cancer, please reach out to us, because we want to be able to share that information. And as you know, because we know that we have people across the country that's on with us today, we are a national organization. So we do want to be able to support those that we know are living with this disease. So thank you so very much for being here today on a Friday afternoon when it's gorgeous outside, at least here in Pennsylvania area, and I'm sure it's gorgeous everywhere. So thank you for being here. Again, this will be recording and it will live on our library. I will put that link in an email when I follow up with the presentations as well. So if you have any questions for any of us, please feel free to reach out. And again, thank you for taking your time to spend with us today. It was great having you. Have a wonderful, wonderful weekend. Michele, thank you so much. And save some for us. Save some of that dip for us.
I will. And thank you, Melissa. It was fantastic today. The speakers were amazing. You really put a great day together.
Amazing. They were definitely amazing. So again, thank you all. We enjoy bringing this to you and look forward to our next one. So very welcome. Bye, Susan. Thank you so much. Great. Michele, great job. I think I'm going to make a couple of those dips tonight.
No, that could be dinner for me. I'd rather have that for dinner than, right?
I agree. I agree. You were wonderful. Thank you. I am going to sign off so I can get to the very next thing. And if I don't talk to you, have a wonderful weekend.
Have a good weekend. Bye, everybody. Thank you.
Bye-bye, everyone. Take care.